Good morning. If everyone could please take their seats, we're about to begin. Okay. Good morning to everyone here in our DC office and to all of you tuning in via the webcast. My name is Erin Currier, and I direct Pew's work on financial security and economic mobility. And I am so pleased to welcome you to this morning's event, Employee-Sponsored Benefits and Family Financial Security. Our panels today feature experts from academia, business, philanthropy, and the nonprofit sector. And we are really looking forward to a robust discussion from lots of different perspectives around the current state of employer benefits, the role they play in family finances, and what the future might hold. I want to begin by thanking our moderators and panelists for being with us today and for sharing their expertise, and also thank all of the Pew staff who have contributed their time and their expertise to helping us organize this event today. The Financial Security and Mobility Project at Pew focuses on better understanding how financially secure American families are and the role that their short-term balance sheets, their short-term financial security, plays in their longer-term economic mobility. We're hosting this event because we're particularly interested in exploring the employer-employee relationship and to better understand the role that employers in particular play in supporting family financial security. Certainly we know that wages and salary are absolutely core to people's ability to have some sense of financial security. But we also believe that benefits that employers provide can go above and beyond those wages and salaries and create an additional level of stability and financial well-being. Aside from our project, there are a number of other initiatives at Pew interested in benefits broadly, including the Retirement Savings Project, the Public Sector Retirement Systems Project, the State Healthcare Spending Project, and several other health-focused teams. Staff from some of those projects are in the room today, and I encourage you to find them and talk to them more about their work. We've also included a sampling of publications from our project and from theirs on the flash drives that you received at the registration table. Before I turn things over to our expert speakers, I want to run through just a few quick housekeeping items. First, our discussion today is going to include a keynote presentation and 3 panels. We encourage everyone in the room and online to submit questions throughout the morning via @PewTrusts on Twitter. For those of you here in our Washington office, we will also have roaming mics for you to ask questions after each presentation. Please use the hashtag PewFamFinance to continue the conversation on Twitter. Bathrooms are located on this floor. The men's restrooms are on this side of the elevator bank, women's restrooms on the far side of the elevator bank, and the emergency staircases are next to the bathrooms. I should also mention that Tony Cheng, a speaker for our first panel, was unfortunately unable to be with us today. It is now my great pleasure to introduce our keynote speaker for the morning, Clint Key. Clint is a research officer with the Financial Security and Mobility Project here at Pew, and in his role, he develops and implements rigorous data collection and analysis strategies to create a better understanding of household saving behavior and the role of savings in people's lives. Previously, Clint was the research director for the Asset Building Program at the University of North Carolina's School of Social Work and a consultant for the Center for Social Development at Washington University in St. Louis. He designed field experiments and statistical investigations into the saving and consumption habits of American households and evaluated the effectiveness of programs designed to help families build savings and assets. He holds a bachelor's degree from the University of Chicago and a master's degree from the University of North Carolina. Clint, I'll turn things over to you.
Thanks, Erin. Good morning. Welcome to Pew. My name is Clint Key. I lead Pew's research on savings and financial well-being. Our project's mandate is to develop rigorous data on the challenges and the opportunities that people face in navigating their financial lives and to vet policies that could help people to be financially better off, more secure, and ultimately more mobile. Today's event springs from our desire to break down disciplinary boundaries that emerge in these fields, particularly the vast array of people thinking about issues adjacent to financial well-being. Too often, thinking in this area gets siloed unnecessarily. Oh, the retirement people are over there. Our retirement team is actually over there, which was a happy accident. People thinking about income, and that's great, but then there are people who just think about employment. But people don't live their financial lives that way. Actual households in the real world lead financial lives. They're integrated across income and consumption, across assets and debts, and every day around their kitchen table make real trade-offs across these aspects and have to balance all of these things together at once. In the fall of 2014, Pew fielded the Survey of American Family Finances. The 7,845 respondents to our survey gave us a unique window into the diverse financial challenges faced by America's diverse households. We observe in this data how people feel about their finances, the resilience that they're able to show against financial shocks, and the level of savings that they have in accounts of all kinds. The data are clear. Americans are wary of their financial situation. Half of American households describe themselves as financially insecure. And frankly, these households have a good reason to feel that way. When it comes to savings, the status quo just isn't working for American households. A third of households have no money at all that they consider savings, and half reported difficulty making ends meet after their largest financial shock. Another thing that was crystal clear in our data, but really isn't part of the policy conversation or the research conversation for that matter, was that at a given level of income, people are leading starkly different financial lives. For instance, households making between $50,000 and $85,000 a year, households right in the middle of the income distribution in the country today, have wildly different levels of liquid savings. At the 75th percentile, the best off 25% of households in that income bracket, the typical household has 3 months of their worth of income in liquid savings. Whereas at the 25th percentile, not all the way at the bottom, but a little ways up for it, households have 1 week, just 1 week of their income available to them in liquid savings. And these are households at the same level of income. There's surely lots of reasons for this. People's incomes are volatile. People have lots of different constraints in terms of servicing debt and meeting current obligations. But an additional answer started to emerge when we looked elsewhere in the data from the Survey of American Family Finances. When asked, workers overwhelmingly told us that employer-provided benefits matter to them. In fact, 98% of workers described their health insurance as important to their household's financial well-being. And we got similar rates when we asked people about retirement plans and paid leave that their employers provided. Now, this finding wasn't particularly surprising to us. If you give people something, anything, they're going to feel a little bit better off than if you don't give them anything at all. But we looked at it a slightly different way. We found that people valued benefits differently than they value other resources, other income that they get. We asked households whether they would rather their employer pay for a benefit, like healthcare or like retirement, or whether they'd rather receive an equivalent amount of cash as a pay raise. More than 3/4 of households that we surveyed told us they would prefer to receive the benefit than the equivalent value in cash. The people are telling us that benefits matter for their financial security and matter in ways that are different from regular income. And we know that employer-provided benefits are also a crucial element of both the social and the private systems of insurance in this country. Most people who have retirement savings plans have them because of their employer. Most households who have health insurance get it through their employer. So clearly, the contribution that employers are making to households' financial security goes well beyond the cash that people are receiving on payday. The panels today are going to explore how employer benefits contribute to financial well-being. But before I get out of their way and let them explain what's actually going on, I want to share some of the new research that we have coming out. When we started taking a look at financial well-being, we realized immediately that a big part of the story was going to be the gap in what some households enjoy in employer-provided benefits that other households don't. But we also found that information incredibly hard to access in the status quo. We worked with the Bureau of Labor Statistics to get special access to the data from the National Compensation Survey. And just to be clear, all of the data and findings I'm about to share, those from Pew, and aren't the opinions of BLS or the federal government. We're looking in these data at just private sector employees, so governmental employees we set aside. Looking across the labor force, jobs come with radically different benefits packages. This figure shows the range of employer benefits. It shows the 75th percentile, the median, and the 25th percentile. At the median in the private sector, employers spend $6.39 per hour on benefits. And often when I give presentations like this, I give the median or the mean and I just walk away. But here the variation is actually what's interesting. 25% of jobs cost employers more than $12 per hour worked on benefits. And at the other end, 25% of jobs come with benefits that cost employers less than $2.65 per hour worked. This is an enormous variation that has huge implications both for the finances of households, but also for the finances of the businesses that employ workers. There are a bunch of interesting things that are going on in the data that we focus on in a brief that we're going to release in a couple of weeks. But just for today, I want to share a couple of things that we're starting to see. First, this figure shows the share of jobs with access to employer-sponsored benefits in different categories. Benefits take lots of different forms, and in this research, we focus on benefits where employers spend money and that are enjoyed by a large share of workers in today's economy. The share of jobs with each type of benefit varies substantially. 89% of jobs provide access to some form of supplemental pay like overtime, whereas only 63% of jobs provide access to a retirement plan, defined contribution, or defined benefit at work. Obviously, this is an important driver of employer costs, but it's not the only one. Access and spending also vary by industry, by employer size, and by worker wage. This figure shows access and costs of benefits for construction industry workers from large establishment, but varies the wage tier of workers. The light blue line, the one in the middle, looks at workers whose income is in the middle third of wages for that industry. The dark blue looks at the upper third of wages in that industry. In this case, if you look at the top of the figure, access to benefits is relatively similar across those two wage tiers. But if you look at the spending down at the bottom, the employers who employ higher wage workers are spending substantially more on benefits and on wages than those who are employing middle income workers in that industry. In the brief that we're going to release in a couple of weeks, we explore the various dynamics of this. But for now, all of you have access to something. I'm sure some of you are looking at this and thinking, I don't really care about the construction industry. That's not my thing. But there's another industry that I really, really care about, and I wish I could get a picture just like this for that industry. You all are in luck. This is an interactive that's available on our website that allows you to look across 21 different industries, 3 sizes of employers, and 3 wage tiers of employers within those industries to get a full picture, a lay of the land, if you will, as to how benefits vary in today's economy. And as we move towards the presentations that are going to talk about how those benefits contribute to financial well-being, I want you to remember the extraordinary variation in what workers actually enjoy at the baseline. For today, I hope we've clarified how much workers value employer-provided benefits and the wide variation in what employers provide. I'm looking forward to the panels, but before I let you hear them, I'm happy to answer any questions from the audience here in Washington or from the audience on the internet who can submit questions to @PewTrusts via Twitter. Thanks. Questions? And there are mics roving the room. Twitter question? Oh, Jeremy? Yeah, please. And if you could say who you are and where you're from.
Sure. Jeremy Smith with the Aspen Institute. So could you tell in the data when you look at, say, the difference between somebody who's getting $12 worth of benefits and somebody who's getting $2 of benefits? Are there particular kinds of benefits that drive that range?
There are. There are certain benefits that are costlier than others. And one of the surprises in the research was that the costliest benefits to employers aren't the benefits that we normally talk about when we talk about employer benefits. When we think about employer benefits, we usually talk about healthcare, and then we talk about retirement, and then we kind of wave our hands at everything else. As it turns out in the data, Other forms of insurance other than health insurance are actually the costliest benefit to employers. Short-term disability and long-term disability in particular are very costly to employers and also very valuable to employees, particularly in the current environment of enormous income volatility. These are benefits that over time could help workers to have a smoother and more consistent income.
James Sang, do you see any correlations between level of benefits and tenure and tenure with an employer?
Unfortunately, because of the structure of the data, we observe jobs rather than the workers who hold them, so we don't have data in the data set that we're using on tenure. Yes?
Dan Gorin from the Federal Reserve Board. Do you have data that look at the benefits by the size of the employer?
We do. In the interactive, actually, let me start over. We do, but. So the data are collected in establishments rather than in firms. So if you imagine Walmart, it's a large corporation, has lots and lots of stores. Rather than looking at Walmart as a firm, it looks at the employees of one specific Walmart in the context of data. So we know about establishment size, the number of people who work at a given work site, and how that relates to the offering of benefits. We can't roll that up into firms, no, unfortunately.
Allison Shelton, AARP.
Sorry.
Do you have any regional data you could share with us?
The data are subdivided by region, and we explore that a little bit in the brief. Just to give a hint, we didn't see huge regional variation in the data once we controlled for other factors like industry and like wage level. Question from the internet?
Question from one of our viewers at home. It seems like you're looking at what point in time. Why is this relevant to the future? Sort of what can we expect?
We made a conscious choice to choose one point in time and chose also specifically to look at data from 2014. The benefit space is an enormous flux in terms of policy. The policy landscape for employer provision of health benefits, for the employer provision of retirement benefits, for the employer benefit of paid leave, are all changing. What we wanted to do was to establish a baseline for what workers of different types across the labor force have before these policy interventions, so that in a couple of years, we can come back later, look at the same data, and make a strong case for what changed based on how things were today. Other questions? More from the internet.
People are very excited. So how are these findings playing into the national discourse right now?
Well, we've just released them this morning, so so obviously we're going to start trending on Twitter just about immediately. We hope that they make an important contribution to the ongoing conversation about how employers contribute to financial well-being, the trade-offs that workers make when taking jobs. And we also think that these findings can inform the decisions that both employers and employees make by giving them better information to consider how good or how bad a package of benefits that they might receive in a prospective job or in their current job. So I'm going to, unfortunately, have to turn it over to the next panel. But before I do, I'd like to introduce the moderator who's going to guide you through the next little bit. Janelle Marte of the Washington Post heads the Get There personal finances section of the Post that looks at various ways that money influences our lives. Her articles show the challenges that workers face as they try to save for retirement while juggling other challenges, such as childcare costs, student loan debt, and flat wages. Marte's story also tracks how workers and retirees may be affected by recent policy changes, including adjustments to Social Security, pensions, and other retirement programs. Prior to joining the Washington Post, Janelle covered taxes, retirement, and other money issues for MarketWatch and the Wall Street Journal. Her work has also appeared in the Boston Globe, the Detroit News, and the Miami Herald. Janelle, welcome to Pew. Look forward to hearing your panel. Thank you.
Thank you.
morning. Thank you so much for having me here. This is very exciting. As Clint mentioned, I do write about these issues often. And I think that one of the clear takeaways from the report, the early glimpse that we got this morning, is that so often the way we think about benefits is perhaps not the way families actually think about them. And that these are things that can affect our everyday, our ability to recover from certain situations, but also even can have a role on the wealth that families are able to generate and to pass along to their to future generations. As we will learn from our panelists, who will explain a little bit more about this. So we have here, which I will introduce to you next to me. So we have Janet Boguslaw, and she is a senior scientist at the Heller School for Social Policy and Management at Brandeis University. We have Matthew Ray from the Henry Kaiser Family Foundation. He's a senior policy analyst. And then we have John Hart, who is editor-in-chief of Opportunity Lives, a news website that's dedicated to highlighting conservative solutions. So we have a mix of opinions here this morning, and I think we can sort of jump right in to start. Janet, if you could tell us a little bit more about how people should think about benefits, and also tell us a little bit more about who has benefits and who doesn't.
Sure, thank you. Good morning, everyone. A lot of times when we think about benefits, we either think in the short term, how is the benefit going to help or benefit an individual or a family in the present moment, or we think about a 401k, right? How is it going to help somebody in the future? We also think of benefits in a sort of narrow fashion. We think of them as healthcare or 401ks, but benefits can be that kind of a benefit that is employer paid for, but we can also think of benefits as flexibility in the workplace, because that enables people to take time off if they need for various medical emergencies or family needs, and if they have that flexibility without it docking their income, then that's actually an employer-based benefit. We also can think about benefits as consistent work. So we can think about benefits as these paid-for benefits, as well as having steady, consistent work without financial interruptions and some level of flexibility. So I would say that, just to be brief, I think that that's an important way of thinking about it, and to think about the ways in which benefits help in the present day to keep people from having financial insecurity in the future. So if you have health insurance, which everybody has talked about as one of the main important areas of health benefits, but if you have flexibility where you can take some time off, or you have paid sick days, then you've got the health insurance that is in place. You have the paid sick days, so you don't have an interruption in your income. And we know that with health insurance, there's always deductibles now. So if you're having a health event, you're having additional costs to your family, it makes it increasingly burdensome if you not only have to take an income loss at the same time that you're having additional out-of-pocket expenses. So we have to think about benefits in terms of how they aggregate and benefit families. I'll just give one more example just to give the idea of it. If you have a flexible spending account that's pre-tax dollars, you're not paying taxes on, you're getting that money in savings, and you could use that money to pay some of those deductibles, or you could use some of that money for some of your child care costs. So in all those ways, they work in tandem with each other to help provide stability. The second part of the question, I think, and we can go into more detail later, is that we know that these benefits are not generally available to people who are self-employed. A lot of them don't pay for those benefits for themselves, people who are in contingent work or temporary work. So there's a large segment of the population who don't have access to these kinds of workplace-based benefits, even though they work. So that's one of the concerns. The other concern from research that we've done in national data is that the benefits go, some of the data that you just were hearing about from Cliff, it goes largely to people in the managerial and professional sectors. And so we know that there's a lot of question about why there's a continuing racial wealth gap. And one of the things we can start understanding is that populations of color are disproportionately not able to access those jobs, whether you want to call that occupational discrimination or segregation. We know from national labor data that about 11% of, for example, of the African American population is in the labor force, but they represent about 25% of the population in the service and retail sectors that are not the areas that are providing these kind of benefits. So we can see what is happening in terms of who has access, not just by income levels, but you were mentioning before, are you interested in construction? You should be interested in construction because who's working in construction? It's those kinds of questions. So that's a first round.
Thank you. And Matt, could you talk a little bit about what the coverage gaps are now in the healthcare space? We know the Affordable Care Act was intended to close some of those gaps, and it did, but employers are still playing a big role.
Absolutely, yeah. So employer coverage is by far still insures more people than any other type of insurance. So since the Affordable Care Act was passed in 2010, we haven't really seen a drastic change in the percent of employers who offer health benefits to at least some of their employees. So right now, 57% of firms with more than 3 employees offer coverage. Large firms overwhelmingly offer health benefits still, and smaller firms are much, much less likely to. It tends to be more expensive. Larger firms are able to leverage their size in some ways to be able to access insurance for their employees. We do know employees sort of all sizes want to have employer coverage. There's obviously disparities in the types of firms which are able to offer coverage. Firms with more low-wage employees are obviously less likely to offer coverage to their employees. But largely, the Affordable Care Act extended coverage through the exchanges and subsidies and various other mechanisms to a lot of people who didn't already have insurance, the uninsured. The employer market is only touched in so many ways here. The employer mandate requires that larger firms offer coverage. As I've said, though, most of those firms already were. There may be some expansion as firms try to avoid the penalties and expand coverage, but there's things working the other way as well.
Okay, and so that's an example of a policy solution to help to expand coverage. And we have been seeing, as someone else mentioned earlier, changes in the ways that people work, and more people working self-employed, or more people working in the so-called gig economy. And so it raises some questions over who should be responsible for providing these sorts of benefits, and what are the policy solutions. John, can you talk a little bit about, we are in an election year. Are we seeing enough interest from the candidates right now?
Well, in short, no, we're not seeing enough interest. And we're seeing what I would call in this election is we have this appeal to nostalgia on both the left and right. I'm not sure I'd call Trump right, but he's the Republican presumptive nominee. That's a broader discussion for after the panel. But so on one hand, you have Trump. Listen to what he said this past week about getting out of NAFTA, talking about lost jobs in Pennsylvania. So Trump tends to treat the economy like if we could only go back to the 1950s, but these lost jobs, he describes them as if they're inmates who've escaped, that if we could just go and catch them and round them up, bring them back, we'd have our jobs back. And that's folly. That's never going to happen. And on the left, I think Hillary Clinton also has a nostalgic view of the economy, that if we could just protect employees from business who often have evil motives, then we'd be fine. But we all in this room know that we can't turn back the clock. We have to figure out how do we communicate these ideas in a clear way. And my background is really as a translator. I worked on the Hill for 15 years for Senator Coburn. I worked for Jim DeMint. I worked alongside Paul Ryan in different contexts. And we tend to do a very bad job on the right of explaining and translating these policies into solutions that make sense. So the site that I run called Opportunity Lives is we're focused on trying to translate and tell these stories of innovation. And a good example that addresses Trump's worldview is the city of Pittsburgh. You have Pittsburgh that's revitalized itself and used opportunity, innovation, innovative grants, new businesses to bring jobs back. And we're not going to do that by tearing up NAFTA. That's just not a realistic solution. So in terms of some specific policies, I want to compliment Clint in his opening, did a good job addressing the fact that all of these issues are interconnected. You can't just talk about employer benefits in a silo. You have to explain how they're all part of the bigger system. So the way to improve benefits, obviously the most important benefit for an employee is a wage and a job. So that's a foundational concept. So deregulation is critical. A challenge that a lot of smaller companies face is, Dodd-Frank. If you own a barber shop in a small town in America, you want to get a $15,000 loan, you're going to have a harder time getting that loan than if you have a $100,000 request in a large city. And this has been studied. The Washington Post has done great reporting on this, actually, that shows how the economy in cities like D.C. and New York has been insulated from the recession to a large degree. Because, again, as you mentioned, that when there's a scale benefit, if you're a large company, you can adjust and absorb the cost of regulation and provide those benefits much easier than you can a smaller company. So the challenge, I think, is as people who have worked in policy journalism is to figure out how do you explain how these medium, smaller-sized companies can do that. We can talk about HSAs and equalizing the tax treatment of healthcare, where you're not discriminated against if you're self-employed or you don't get insurance through your employer. But obviously we don't. That's what 150 million people get their insurance that way. Mm-hmm. So you have to do it in a way that doesn't disrupt the benefits that people already receive and are working.
That leads to what was going to be my next question, which is these benefits all have a cost, right? So what are some of the ways that employers and employees are sort of sharing those costs, and where do we strike the balance to make it affordable to both parties? Whoever wants to.
I can weigh in on that. This isn't going to be a newsflash to anybody, but health insurance is really expensive. So the average family policy now is almost $18,000 for a family of four, or just one person, it's $6,000. So when you think of what the median household income in the country is $55,000 or around about there, you can think about a huge percentage. The average health policy is. And it's hard to underscore Clint's points earlier about how much variation there is strongly enough. You see employer plans that go up to $35,000 for a family coverage, and you see plans that are much, much cheaper. And the assumption there is they're of much, much different quality. What's been interesting is that over the last 15 years, I work on something called the Employer Health Benefit Survey, which is sort of a benchmark survey of employers and their health benefits. So we've been doing this survey since 1999. So over that period, we've seen the percent of the premium that the employer contributes to has roughly stayed the same. So the employee is roughly paying the same amount towards single coverage and family coverage as they were 15, or I guess even longer, 16 years ago. What's different, though, is the cost is much more expensive. So we've just seen premiums grow at sort of a clip. So over the last 5 years, premiums have grown 5% on average, so much faster than workers' earnings and inflation, which has sort of an impact on the actual dollar amount the employee is contributing is going up. So the average family now is contributing about $5,000 roughly to an employer plan for family coverage.
And how does that play along with the deductibles? What are the changes in the deductibles?
Yeah, so this is the thing. When we think about affordability and financial security, everybody wants to have health insurance. The key is that you can afford to use it. So you're obviously better off on average in the employer market than you are in the individual market. So the term they use is actuarial value, which is sort of the percent of the out-of-pocket the expenses you have for an average population that the plan covers. So the plans in the employer market tend to be much, much more generous. But at the same time, we've seen with sort of increasing cost, employers are looking to reduce cost. There's only so many tools you have to do that. You can make your network smaller, you can drop some covered services, or you can increase cost sharing. So what we've seen over the last 5 years is this cost sharing has grown much, much faster than has the cost of the premium. So the deductible, general annual deductible is the amount you've got to meet before the plan typically covers any other services. We've seen two things. One is that more people have a general annual deductible. So 4 in 5 workers, roughly, now have a general annual deductible. And the average value of the deductible is much, much higher. So you have a deductible. That deductible is now $1,300 on average. So there was a point in which I think, and you may want to comment on this, that we had this discussion over like having workers put more skin in the game, give them more sort of the financial risk of their healthcare consumption. I think it's important to, when we're thinking about affordability and financial security, to think about how much people can actually afford. So one of the things, someone here was from the Federal Reserve, one of the things we did using the Federal Reserve's data, they have sort of a phenomenal survey called the Survey of Consumer Finances, which is just terrific. What they do is they do a survey of households, ask them where all their money is. Bank accounts, checking accounts, money market accounts, between the cushions in the sofa, under the car seat. So what we did is we tried to calculate the percent of households who had enough liquid assets in all of those places to meet sort of the typical deductible on an employer plan. So amongst people with private insurance, it's about roughly 4 of 10 don't have the liquid assets to meet sort of the typical deductibles in the employer market now.
So that's not a lot, right? There's a lot. So clearly it can
Well,
be
that's
a burden.
what we decide is that's more a judgment call.
Right. So, Jenny, could you talk a little bit about for families having to chip in a little more? How can that put a strain, or how can that affect other parts of their finances?
Well, this is the danger of having panelists live, because I'm going to reframe that.
Oh, sure.
Because I really want to respond to a little bit of the framing. Certainly, healthcare costs are a lot, and people are starting to have to pay more deductibles. But I also think that we have to understand that there's a lot of data now that sort of the high road companies, the companies that are providing these kinds of resources to not only high but moderate and low income employees, find that there is increased commitment and understanding and participation in the workplace that helps them create savings in their job, in the jobs and in the work that they're doing. And those savings can be used to be rolled back into helping provide these kind of benefits. So it's not always just that it's a drain. It's also looking at how do benefits provide a more stable and healthy workforce. And that having a healthy workforce means that people aren't going to be out on sick time as much. They're not going to be out with or coming to work with illnesses that get other people sick at the same time. There's a lot of data that says that when you provide these kinds of resources, it stabilizes your workforce, and that workforce is more productive, and you have greater productivity. So there has to be a balance. There's certainly costs to corporations, and I think when you get into the smaller businesses, there are bigger costs and challenges. There are opportunities for using, I think, the tax system to create incentives for some things that are as radical, you might think, or as conservative as you might think, as like employee ownership, where people are getting the benefits, but more of the resources are coming back to them in different forms, or even worker co-ops through tax structures. So the benefits are can be costly, but they can also be a cost savings in the right context and used in the right way. And when you think about how it stabilizes families over the long term and in the short term, we can think about it in a different way, I'd say. So the costs are real, but we can frame them in a different way to understand how they contribute to a business's bottom line.
I absolutely agree. To say it's expensive is not to say it's not important. People want health insurance, and they want it for really good reasons because it provides a tremendous amount of financial protection.
So, as Clint mentioned, also many people would rather have the benefit than the cash. What does that say about people's ability and willingness to take care of these kinds of things and make these kinds of decisions? And also, what are some of the non-traditional ways to offer flexibility or to offer benefits that would be helpful to people, but maybe more affordable for everyone? Do you have any thoughts?
Well, I would just pick up on. I mean, sorry, tell me your name again.
Janet.
Janet. What Janet said about businesses that offer these benefits on their own is absolutely right. That if you incentivize wellness, if you incentivize prevention, that pays for itself. And I think the policy question is, well, who's in charge of creating that set of incentives? And I think the challenge we've seen with the Affordable Care Act is that often the best way to make something expensive is when government steps in to make it affordable, because you create a regulatory structure that ends up increasing costs and premiums, and that's the result of what we've seen. So the shorthand explanation I give on healthcare is that before the Affordable Care Act, we had the worst of both worlds. In other words, we've been living in a public-private hybrid and will for the foreseeable future. And that's what Europe does, and that's what most systems really are, is that there are very few pure market-based or government-run systems. But we've been getting the worst of both worlds, and Obamacare, I think, made that problem actually worse rather than better. So the challenge is, how do you create a competitive market so that you allow innovation, you make products compete, so that people can access different choices at a lower cost. And the two sectors in our economy where we trust the free enterprise system the least are healthcare and education. So it's no surprise that the costs have gone up and have been very difficult to rein in.
Beyond paying for these things like healthcare and having access to paid leave, or things that we sort of obviously know are considered benefits, how can having some of these other perks influence, or if you would even call it a retirement account a perk, right? How can it influence other aspects, such as a family's ability to build wealth in the long run? I think, Janet, you mentioned that, I know in some of your work you've seen that even if among families who have, or among kind of populations that are both seeing changes in gains in income and in education, that having access to benefits can make a difference in their overall long-term ability to build wealth.
Yeah, so in some of the research we've done and some of the national data backs this up, we've seen that, overall there's somewhat of a decline in the income gap. There's a huge growth in the wealth gap that's been taking place. And we also know that people are becoming increasingly better educated, right? A lot of people are getting into, not just stopping at high school, they're going into community colleges, they're getting high school degrees. But this isn't really translating into long-term greater financial stability for a lot of these families. So, the question is, why not, right? Why isn't income and education translating the way that we would anticipate that it's translating? And part of that is what I talked about earlier, is that where there's still occupational segregation and barriers to advancement, that education isn't translating into the kinds of stability that people hope for. So we see a lot of data now where, because it's the gig economy and everybody's working as a sort of a consultant. Everybody's, got their own name, their own card, and taking place. But one of the things that's happening with that is that everybody's working as an independent entrepreneur, and they aren't necessarily being able to get the benefits that are providing them, with the financial security. So if you're an entrepreneur and you don't have paid sick days, and you don't have paid vacation, and disability insurance is really, really expensive on an individual level, then if you get sick or you break your leg or something else happens, your income is completely wiped out. And if you had anticipated that you could pay that mortgage that you wanted to be paying because you were college educated and you're on the high road of being this entrepreneur, it can be really challenging all of a sudden to pay that mortgage. It can be really challenging to pay all the other expenses. And so we see this disconnect. We also see it at the lower ends, the entry level workforce coming in. There are a lot of job training programs that are training people to go into the healthcare sector. It's funded, some of it, under the Affordable Care Act because it's a growing sector. But what we're finding is when people get into those first jobs, they're per diem jobs. They aren't getting into full-time jobs because the healthcare employers want people to have experience. Well, when you're coming out of a job training, you don't have experience. So you've got you might have a higher hourly wage when you look at the hourly wage level, and you might have the degree or certificate, but you don't have full-time work with an attachment. And so there's a disconnect there, and maybe the solution is for people to have full-time work, and I think that consistent work is a really important benefit when we think about it, but maybe there's also ways to have more portable ways of setting up the kind of benefits that we want so that people can have access to those and begin to build their wealth at the same time.
We're seeing a little bit of that with the MyRA, which is a retirement savings account that people can take from job to job, ideally. But of course, one of the issues is that it's a small savings account. The pros are that it makes it easy for people to have that taken directly from their paychecks, but anyone can do it pretty much if you don't have access to a retirement account. But it's kept in pretty much in cash, and it's only up to $15,000. And then we see some other possibilities here with, again, the Affordable Care Act created an exchange for people who didn't have access to insurance before. But what are some other ways that the public sector and the private sector can sort of work together to help make sure that everyone has the benefits that they need?
I mean, obvious answer, I think identifying and publicizing best practices is really critical for anyone with a platform, anyone who's a leader in the policy community. Because again, it's one thing to have the high-level discussion of how do you reform the U.S. healthcare system, but there are dozens of companies doing innovative things to provide good benefits to their employees that should be applauded and replicated. So in the interim, before we solve the grand problem, is identifying and connecting leaders within states and local communities. And I think on the poverty issue, that's particularly important. And I give Paul Ryan a lot of credit for acknowledging, again, the interconnectedness of this. One of the images they use in healthcare, but it applies elsewhere, is this idea of a backpack, that you take these benefits with you from job to job. And that's a useful way of framing things. Obviously incentivizing work and addressing the income cliff is a big challenge on the poverty front, where if you make a certain income, your benefits drop off. Well, how do you solve that? That's a key challenge as well. But I think elevating best practices is really important and can't be overstated.
Mm-hmm. I also think that the challenge with policy solutions that just look at portability is that we have to look again at how these benefits work in tandem with each other to create stability. So you don't want to have a situation where people's incomes are going up and down and people are in and out of the workplace, but maybe they have steady benefits. That provides a safety net. But what we really want to do is family financial stability and security is not just in the present moment, but it's how people think about the near future and then the far future. So people need, in order to be able to plan financially or to make investments in the short term, buying a house or even taking a vacation or anything that everybody in this room probably thinks about doing at some point, you have to have the combination of consistent work, which is not necessarily a job, but not having a gap in your income. All right. So if you're going to have people and we're going to have a contingent or temporary workforce, then another employer or employment-based policy needs to be a way to smooth that income and make sure that in between jobs, people's incomes aren't dropping significantly in a way that affects their security. So you want to have that stability in income flow, and you want to have the benefits so that when there are needs, even when you take a vacation, if you have paid vacation time or sick time, when you're using both of those, your benefits, or if you have 401ks, are still accruing. If you have an employer match, they're still matching it while you're on vacation, or they're still matching it while you're taking sick time. That's real money in your pocket, and that's real money for long-term financial stability. So we have to understand how to have the benefits so people don't draw on their income for things that are normal parts of living, and that they can build on that to have future stability and security. So I think it's both to think about.
That's true. And it also, because I read a lot about the retirement savings gap, and a big issue is access to the retirement plan, but also the ability of people to save. And a lot of time you hear this idea that people should just be paid more, and to an extent, of course, that will help. But for the companies too, there's, like we've been talking, there's a cost to providing those benefits, and the cost, they have to find a way to balance it all. So I think we're having a good discussion here. We'd love to have some time for questions. Are there any questions from people in the audience about the various components or things that you would want to learn more about? We have one.
Hi, Angela Rashidi, AEI. I'm just thinking about the push for minimum wage hikes, and given what was discussed earlier about it seems as though employees value benefits possibly more than wages. It seems likely that if there was a large minimum wage hike to $15 an hour, for example, and maybe that trickles up a little bit, that employers would be forced to possibly pull back any employer benefits, that even how meager they are for low-wage workers, they might have to pull that back a little bit. And so I'm just wondering the panelists' thoughts on the huge push towards a minimum wage hike and what that might mean for employer provided benefits.
Who wants to go first?
Maybe I'll say something, but you guys feel free to add on. I'm curious in the way you asked this question, because I think part of the reason why that's maybe the result is because of the employer benefits are just so you get a huge tax subsidy, tax break, by getting your compensation as a benefit rather than as compensation. So I could see if you frame the question in that way, then you would get this. That would make sense to me that you get a result of a lot of people saying, "Yeah, I'd rather have $5,000 of benefits than $3,000 of cash." But I'd be curious to know exactly how this was set up.
Sure. In the survey context, we usually don't try and give people that much information and force them to make a calculation like that. So we actually just framed it straight up. Would you rather have the benefits that you currently receive, or would you rather have the equivalent value in cash?
It's interesting because employers who we ask typically say that they believe, employers who don't offer health benefits typically believe their employees would rather have raises than benefits. So it's actually, employers are on the other side of the question.
That's a good point. And then, do you want to say?
Yeah, I just wanted to respond briefly to your question. A lot of the data of the businesses that are providing good benefits to their employees, again, at the moderate and lower income levels, are also the ones who are paying higher wages to those populations. So one of the things I think the data has shown is that you can provide good benefits and you can pay close to living wage hourly rates, like the $15 an hour or above, and you still can make a profit in your company. I think, again, it always gets into discussions about very small businesses and how that may affect them, and it may be that there need to be greater tax supports for potentially for very small employers who want to provide those benefits if they're really operating at the margins. But there's evidence that the $15 an hour is not having that kind of a negative effect on benefit provision in most companies.
Just 2 quick points on that. I think it's problematic for a couple reasons. Number one is that a national minimum wage doesn't account for regional differences. So obviously, Nebraska shouldn't impose a national wage on the rest of the country, nor should New York, with their cost of living do the same. So again, the policy doesn't make sense for it to be set from the federal government. And then secondly, it is harder for small or medium-sized businesses to absorb that cost. I think it's true that the higher people who pay more do provide more benefits because they can afford to. But given the contingent economy or gig economy we're living in, it's not a wise thing, I think, for the federal government to set that.
Debbie Chalfie with AARP. I was wondering, Janet, if you could talk a little bit more or elaborate a little bit more on one of your last points about looking at portable benefits and not overlooking sort of what some of the other components of economic stability are and how they work together. I was wondering if you could just talk a little bit more about what you're seeing in the way of sort of solutions or responses to the need to provide that stability that either our current employer-employee based system isn't providing or a portable benefits system might not provide.
Well, I think that, I know some of the other panels will be talking more to those policy issues. I think portability or, having the issue of portability gets into the concern that some people have that it's socialism. It's the national programs that people are concerned about at having. So there's that aspect of it. Do we have national 401k programs that are attached to anybody who works? Do we have all these kinds of things that sort of level the playing field, don't make distinctions? I think we're probably pretty far away from having those kind of national-based programs. But at the same time, I think there are ways to incentivize employers and also put it's where I probably started out. It's the reframing of these issues. So when somebody isn't attached to a workforce and they have a number of these benefits, they don't always work in concert with each other. So think about an example of, we did a number of interviews with a lot of people about their financial security. And I'll just give you one example. A woman who's married who works as a nanny, she works for 2 different families. She makes about $3,000 to $4,000 a year. Her husband works full-time. He makes $35,000 a year. Angela talked about what happened when her husband got diagnosed with cancer. He had health insurance, but he also was at a workplace that allowed him to use his sick time in hourly increments so that he could go to doctor's appointments and he could decide if he was having bad effects from chemo, whether he needed to take an afternoon off or a day off. They own a house. They were really worried when he got sick about would they be able to still pay their mortgage. While he was still at his company and going through all this cancer treatment, not only was their present day stability, financial stability, actually pretty intact, but his 401k was there and kept accruing because he had an employer match. So there's a lot of pieces that go into benefits, and some of it is around the flexibility, some of it is not losing your income. And I think that when we just think about portability and we just think about it as detached from the relationships in a workplace that people have, we lose something about how the accrued value takes place. So there are going to be people always who are not attached to a permanent workplace. But it may be that we start thinking about it as being attached to a sector in some way. Or, you know, again, the people coming into out-of-job training programs who are getting per diem work or less than full-time work as they build experience, they need to have some kinds of benefits that are available to them. But the goal is for them to get into permanent and consistent work. So we don't want to say that that per diem and that inconsistency is something that's a goal or something that we just want to accept. I don't know that it's going back to, you know, some idealistic ways of thinking about how work used to be organized. Work is going to always is organized in different ways now. But we still have to think about how people are going to have an attachment to the workplace or to community or to government or to something so that they can have that stability. Because family financial security requires some level of stability and planning around resources. And so volatility around resources, benefits, or income isn't going to enable that kind of financial security or mobility that Cliff was talking about.
Can I add a quick point on that? I think I agree with all of that. But just, you know, I think, as you said earlier, we've got 160 million people in the system we've got. And I think I don't have a particular opinion on what the result is, but we have to have a discussion or at least think out what we want employers to be doing in this system. And right now, employers, they do a lot in the provision of health benefits. If we want employers doing things like wellness programs, and if we believe in some way that employers are helping to reduce costs by being good at negotiating with insurers and fighting for networks that make sense and tiered networks and all of these other things that we think are going to have some sort of contribution on the cost curve, there's a tension there with how we think about that in conjunction with portability. You know, there's obviously HSAs, which give you some level of portability, but, you know, they're still relatively small in the market. Most people don't have one. The overwhelming majority of people don't have one. So I don't know. That's a harder question when we get to portability and employer benefits, unless we're doing a major rethink of what we've got.
I have a follow-up. So John mentioned regional differences and why a national solution for the minimum wage may not work in some cases. And even for retirement accounts, I mentioned earlier the MyRA, but we're also seeing some of the states really pushing to create their own programs because they want to fill the need for their residents, or even at the city level, we're seeing some interest. So what are the pros and cons of having these sort of local, state-based solutions, and how can that affect someone's ability to kind of maintain those benefits over time?
I would just quickly, there's many pros and very few cons of that. The state treasurers actually, some are doing a great job on financial literacy. North Dakota, Mississippi, others are teaming up with, you know, private companies to educate people about the dynamics that Janet has pointed out very well in this changing economy. That if you have an unexpected gap in income, and we have this changing system that isn't properly funded, no one's talking about how these programs are all going bankrupt. You know, we need to have people step in and offer services so that people can make good decisions. And so and the states are better equipped to do that. The closer you get to the community, the individual level, the more effective those campaigns tend to be.
So that may be true for a lot of the sort of other benefits. When we're talking specifically about health benefits, though, 60% of covered workers are enrolled in a plan which is self-funded. A self-funded plan gets federal preemption on state regulations. So they don't have to make all the state regulations in whatever state they are. So there is, to some extent, states don't have as much influence over their larger employers, those are the employers that tend to be self-funded, to do sort of the regulatory things around the edges there. Obviously insurance is regulated at the state level, so states play an important role in regulating insurance for sort of their smaller and mid-sized groups.
And one other thing I'd add to that is he asked a question when Cliff was talking earlier about sort of what role do benefits play in people's, in a sense, mobility. And some of the research we've done shows that when people are concerned that they're going to lose benefits, whether they're going to lose their health insurance or other kinds of benefits, then they aren't as willing to take some of the risks of career advancement. They may not feel that they can switch to another job and test it out and go to that next level because they have a sense of what they might be giving up or they might be losing, and they're trying to balance those risks. So to the extent that there is some kind of portability or security or just making sure that it's available in more workplaces, that kind of self-restriction on career advancement might be eliminated a little bit more. So,
any other questions from the audience?
Hi, Rachel Siegel from the Pew Charitable Trust. I'm curious about how people looking for work can compare benefits packages between different companies and organizations to try to understand what real value there is in those benefits.
It's a really tough question.
Yeah, it's hard, right? You get your plan document, and it's hard to compare plans, and it's also really hard to compare your networks, if that's something that's important to you.
Yeah, I mean, the senior citizens have the same problem, right?
Yeah.
They're trying to understand, what's taking place. But one of the things that we're trying to get started is, you all know about sort of work-ready programs for people coming out of job training. We're trying to get an additional component added into those where it really tells people about the benefits that they might get on the job, how to access those benefits, how to utilize them, how to work with HR departments, all of these things that people don't typically know about and might not know to ask those sets of questions. And so we're trying to get that as something that would be part of the ongoing training at baseline, so people start to ask those kind of questions because they often don't even know to ask.
It's a problem of price transparency, lack of clarity, and that if you have a cleaner, competitive market, it'll be easier to shop for insurance. And it's a bit of a travesty. It's easier to shop for a car or a computer than it is for something that's as vital as health insurance.
We have a question from the web. In terms of data, what do we not know? What's left to learn? And how can we do that?
Well, we all want to have jobs going forward, so hopefully there's lots left to learn.
I thought Kaiser knew everything about health.
Striving. We're in a changing world here. There's a changing market. The workforce is changing. Health benefits are changing, and there's plenty left to learn. Yeah.
Yeah, I think that we need to understand a lot more about the relationship between benefits and family financial stability, both in the short term and the long term, and think of it as a continuum. And a lot of times people talk about, there's research that you've done with Pew even on economic shocks and how economic shocks affect families, but we haven't really looked at in as much detail at how the combination of benefits and relationships with the workplace help stabilize families and help them, if you're stable, then you can grow from that point of stability. If you're unstable, you can't really have mobility and move up. So I think it's a really great question that we all need to think about.
The Funders Network. Not too long ago, there was an article in the New England Journal of Medicine, kind of an editorial piece, which talked about, basically illustrated the discrepancies between different levels of employees. So an employee who was very loyal, this was at a very prestigious medical institution not too far from us, who could not afford that institution's health plan, and therefore was using what was on the market, that sort of thing. So we've been really focused on healthcare, and we But if we take that and translate it, and the bridge is you're talking about the entry-level healthcare worker and so forth. What is one of the biggest expenses for a family that has either or both or however many workers? It's childcare. And very few employers offer a childcare benefit, or relatively few. And that's one of those circular things. I mean, it is so expensive. Trying to balance that, and I'm wondering if you have any suggestions about policies that would balance, we want people to work, but they can't work if no one's taking care of the kids, and that sort of question.
Do you want
Yeah, it's outside my area of expertise.
No, that. Well, you know, the child care issue is really complicated because we all think about child care just as a regular child care, but it's a particularly big issue for people with children with disabilities because the options for child care are very limited. Sometimes you have to have some flexibility around your schedule to be home for a bus because nobody else is going to be able to meet your kid, you know, at the bus to bring them in. And that's why flexibility is one of the components of benefits that I think is, from our research, becomes really important in a workplace that it's covering the costs. A lot of times we find with lower income workers, they split shifts. So one parent works one shift and the other parent works the other shift so they don't have to pay for child care. That has some negative impacts on the family stability, whether it's the financial stability or not. You know, if you never see each other, that's kind of a big problem. And I think that more and more we're seeing, again, these high road employers are trying to build in flexibility so that parents can work 4-day weeks and have 1 day at home so that they can reduce their child care costs that way. So there's a lot of ways that I think employers can mimic some of the benefits that you get with healthcare, like sick days, you know, by matching that into child care options. It's particularly difficult for families with children with disabilities because they have not only often additional health care costs, but they have either really high child care costs and everybody thinks that they just are in the same group in terms of health care costs. So it's another area that health insurance might be able to fill that gap by providing some kinds of resources for child care when it's a health-related issue. So I don't know if that begins to address some of that issue. Anyone else?
Yeah, there some policymakers have talked about expanding the child tax credit, making it refundable, advanceable, so you get the benefit throughout the year to help offset some of these costs.
And are the solutions more promising solutions in the tax code or in terms of what employers can offer? Because I know there's a spending account flexible spending account for child care expenses. But for, it's such an individual situation that, maybe employers have some challenges with figuring out a way to offer this to the people who need it, but still, containing the cost for the company. Any other questions?
Dan Gorin, Federal Reserve again. Can you talk to the issue of how tax preferences, financial security differences between high income and low income individuals by making so many of these benefits available in larger dollars even to wealthier workers and having them being subsidized in a sense by the average worker? So Cadillac insurance plans, for example, where so much extra tax deductions and tax exemptions go to higher income people. In DC, we could think of transportation subsidies where higher wage workers, federal government employees get. Lower income employees are less likely to have advantages like that.
Yeah, the House white paper on healthcare addresses that, where there's a cap for higher income, these Cadillac plans to help offset the cost of creating other high risk pools and other things in the tax code to provide and equalize that benefit. So you're right, it's a huge problem.
With health insurance, right, we have a progressive income schedule. So the more money you make, the higher your tax rate. So if you give if we're not going to tax the value of the health benefits, then rich people are going to get a bigger break than our poor people and or higher income households. We also know that higher income households are more likely to have a more expensive policy than is sort of a low income household. So it's an issue. It's something to think about. This is I think I got to the mortgage interest tax deduction. This is our largest tax deduction. It's a hugely expensive thing that just it helps provide sort of the glue that keeps the employer system moving forward.
That's an easy one to reform, the mortgage one.
Yeah.
But I think it's a point well taken that, we think of work supports as social welfare, and we don't think of these tax deductions at the higher end as social welfare, as part of the social welfare system. It's all part of the social welfare system. It's just that at the lower income levels, people think that it's a subsidy of some kind, and at the higher end, it's somehow something that's, something that people have come to expect that is due them. So I think that part of it is making this more visible and understanding where do people need the resources to make the decisions. The mortgage deduction is the perfect example, and finding ways to be able to invest those resources to stabilize all families and not just use it as incentives. At this point, it's used as an incentive system at the higher income levels.
Just quickly, I would just echo Janet and applaud that. We actually, in Coburn's office, did a report called Subsidies for the Rich and Famous that catalogs some of these benefits. Because you're right, it should be treated as a subsidy and social welfare, even if it's perceived by wealthier.
So I have no opinion on that particular proposal, but we also have to think out, do we want our system right now is set up so that employers do the vast amount of coverage, provide the most amount of coverage. They cover 160 million people. If we start to peeling back those tax subsidies, they're going to have an impact on firms' decision to offer coverage.
We can't lose sight of what's really important. We want people to have health care coverage, right? We want people to be healthy. It's good not only for families and their financial stability, it's good for our economy when people are healthy and when they're not sick. So there's an incentive, there's a bipartisan incentive, I think, for everyone to make sure that people can be financially secure and that the things that are most critical to our well-being, things like health, retirement security, participation in family life, all of those things are there because that's going to benefit everyone, and we don't want to just have it benefit a few. So, obviously the next panels will be talking more about what are the policy solutions and how do we get there. But I think that there can be a danger, and again, thinking about these as what are the costs and how do we negotiate that when we have to keep our eye on what's the big prize. The big prize is, we know the social determinants of health are such that, that the actual healthcare piece is very small, and it's all these other things that create stability and good health in people's lives that are really important, and that will also reduce healthcare costs and bring down some of these premiums. So, whether it's childcare and you're at work and you don't have to worry so much about who's taking care of your kids, it can be all of these things. But I think what we have to do is figure out how do we smooth the access to those kinds of resources so that families who can't buy it in the private market at the level that they want, at the quality that they want, that everybody can have the quality that they need to be financially secure and healthy, I would say, is part of that. So it's not an either or, it's more how do we get there.
Well, I have a follow-up question. How do the tax incentives play out in the retirement space? There is talk about, clearly for people on the higher end, there's more of a benefit because you are in a higher tax bracket. And then on the lower end, we hear, well, maybe we need to have more of our savers credits or other things because there's just not as much, you talked about incentives, it's not as much of a tax saving to save if you're already in a low tax bracket. So are there any things that you, or programs that you think have worked more or worked better in that respect?
Well, this is going to sound a little radical.
Okay.
But one of the things that we're doing some research on now that I'm doing with a project at Rutgers is looking at how employee ownership helps stabilize low and moderate income families' long-term security. And one of the things that we're finding is that the ESOP accounts provide a lot of security. So that's an extra account that people can get, which is, there's a lot of work being done in that area.
But you did explain it's where employees are getting stock, right?
They're getting stock in their company and it's going into an account. And typically and there are tax incentives for employers to set up these ESOPs. And when employees get to age 55, they can start diversifying their accounts, putting some of the money into IRAs, other kinds of stock options. And then when they retire, they have stock from the company where they've been working. So that's just one idea that there are some alternatives. But I actually think that in terms of retirement security, Social Security is really important and it needs to stay intact. And the idea initially for Social Security is that it would keep seniors from being in poverty in their old age. And the value of that Social Security actually has dropped some since it was initially established. And now there's discussions about cutting that back further. And that's a really important piece of, I would say, the social contract. And it's important for people to save for their future, but it's probably also important to find shared systems so that people who were not able to pay in, the nannies, the others who are not part of that formal system have security and stability, the caregivers who've had to drop out. So there's a lot of work to be done, I'd say, to not say that it's only an individual responsibility and only tied to work that you're going to be secure in your old age. So there's a lot of policy work to be done in that area.
We have another question from the web. So how are the policies, programs, practices, needs of employees, and some of the things you're talking about differ by employee age?
I mean, maybe the access to some of these benefits?
I assume the meaning was just, are there different solutions depending on the age of your workforce, if you're an employer?
If you're an employer.
Well, I could think that, employers offer health benefits and all benefits, but especially health benefits because they want to retain good staff. So if you have an older workforce, I would assume that would change the preferences of your workforce. I don't know if I have anything to add beyond that.
Yeah, I think that we know that as people age, they're going to probably be using healthcare more frequently. So one of the things to make sure is that people aren't facing age discrimination and losing their jobs because employers are concerned about any kind of a rise in the costs of healthcare. That might be one piece of it. And then we know some companies add a little bit extra to what they, to their share of the 401ks as people hit 55 as they get closer to retirement. So there's ways that employers can also accelerate some of the security.
Are there also any trends in terms of the types of benefits? I guess another way to put the question is, are younger people more or less likely than older people to have access to some of these benefits based on the jobs that they get? You talked a little bit about the entry level.
Yeah, I think if you're in the professional and managerial, areas, you're getting a lot of benefits, and that segment of the young population is getting a lot of benefit and being wooed. At the same time, that's the flip side of that is we know that, people over 50 who've lost their jobs are not getting hired. So there's the long-term unemployed of that aging group. And so, yeah, there's a question of, are those benefits being shared among all parts of the population, and what's happening to that older population who doesn't have the steady access, especially as their needs may be growing at that life stage.
Well, I think we have room for one last question.
James, related to the last question, it's probably more for Mr. Key than anybody else. You pointed out that lower income people get smaller benefits than higher income people, at least cash-wise. Do you have any idea as to the nature of low-income benefit plans with respect to things like alcoholism, mental health, obesity, those kind of lifestyle protections as compared to the high-income plans?
No, though there are data in the BLS system that speak to the composition of a health plan with that level of granularity, that wasn't the part of the data that we were looking at. We see a strong association between the wage level of an employee and the cost to the employer of the package of benefits. A big part of the explanation of that is that lots of benefits are actually indexed to the wage. If you think about employer spending on legally required benefits, for instance, like payments to Social Security or to Medicare, those are actually calculated as a proportion directly of the employee's wage. You see something similar with respect to retirement plans, and that's a big driver of the gap in benefit spending by wage.
If you follow up with me afterwards, I can provide you some data on firms with high and low income workers and how extensive their wellness and disease management programs are.
I asked the question in the context of the case.
Oh, okay.
Work on lower income Americans and increased mortality rates, decreasing mortality rates.
Okay. Well, I think that does it for now. But thank you so much for the panelists here who joined us today. Thank you to Pew for having me. I think we learned a lot, and we'll continue to learn more throughout the day. Thank you.
Thank you to members of our first panel. At this time, I'd like to invite members of the second panel to head over to the mic table to get mic'd up. And while they are doing that, those of you in the room should feel free to take a 5-minute break, stretch your legs, tweet about the event, check your email. Thanks. Okay, we are now going to begin our second panel, which features the employer perspective on a changing benefits landscape. I have the honor of introducing our moderator, Kimberly Adams. Kimberly covers politics and general news for Marketplace from the Washington, D.C. Bureau. Before moving to D.C., Kimberly reported on the political, social, and economic upheaval in Egypt following the Arab Spring as a freelance journalist based in Cairo. Her work aired on multiple networks in the U.S., Canada, UK, Ireland, Germany, Hong Kong, and elsewhere. While reporting in Cairo, she received awards from the National Association of Black Journalists, the Religion Communicators Council, and the Association for Women in Communication. She was also competitively selected for the International Women's Media Foundation Great Lakes Reporting Fellowship in Uganda, where she reported on environmental, economic, and LGBT issues. Welcome, Kimberly.
Thank you very much. I appreciate it. And thank you very much to Pew for including me in this panel. I think it's an extremely important topic, especially in the changing workforce that we have in the United States, which has been quite a topic in our 2016 presidential campaign, which is what I'm covering for Marketplace. I have the distinguished honor to move my hair out of the way and introduce our panel. First, we have Holly Wade of the National Federation of Independent Business. She's the Director of Research and Policy Analysis and provides analysis on public policy issues and economic trends affecting small businesses. She also produces the monthly Small Business Economic Trends Survey, as with the chief economist of the National Federation of Independent Business. She's also a member of the National Association of Business Economics, the National Economists Club, and the Department of Commerce's Industry Trade Advisory Committee on Small and Minority Businesses. Thank you. Next up, we have Jim Klein of the American Benefits Council. He is the president of the American Benefits Council, which is a trade association based here in DC, representing primarily Fortune 500 companies that either sponsor or administer health and retirement benefits covering more than 100 million Americans. He's frequently quoted in both the national and benefits media, I can attest to that, on pension and healthcare topics, and has appeared on major television networks discussing a wide range of employee benefits policy matters. He's a founding board member of Americans for Generational Equity and serves on the Government Liaison Committee of the International Foundation of Employee Benefits Plans. Finally, we have Eric Redding from Small Business Majority. Excuse me, Redding. He builds
all the time.
He builds and maintains strategic partnerships with small business owners and organizations throughout the Eastern Seaboard. He educates small business owners and organizations about the Affordable Care Act, clean energy policies, key workforce issues such as family medical leave, and other important small business issues. Previously, he worked as a small business advocate around the DC and New York metro areas. He also worked on political campaigns and as a staffer in the House of Representatives. Thank you. So we're going to start by allowing each of our panelists to give their own comments for a few minutes. We'll follow up with a quick Q&A from me and you guys, and then we'll open it up to questions from the audience and the internet. For those of you watching online, please feel free to send your questions via the hashtag PewFamFinance and also by email during the webcast. Please go ahead.
Great, thank you. I think this is an important time to talk about these issues. And also great panel to put these issues in context between large employers and small employers and the different situations that they find themselves in providing benefits and compensation packages and the different challenges. So to put the small business sector in context, NFIB represents about 350,000 small business owners across the country. And we have a unique ability to survey our members on a monthly basis, and we've been doing this since 1973, looking at the different changes in their operating their business, and then also how they see the economy at large. So currently, they look at the small business sector, the economy, their ability to raise prices and compensation and profits and things like that. They're still very risk adverse. So their plans to increase compensation, increase prices, are still at basically recessionary levels. Their actual increase in compensation and prices are a little bit above that and a little bit more above than what we would normally see. The overall small business economic picture, though, is fairly gloomy. So while there are the employment sector piece of our survey is showing a tightening of the labor market, and more of them are looking to hire and have open positions, they're having a difficult time finding qualified employees. They're also up against, though, a very sluggish recovery, and also after the recession. And so they're risk averse, the economy's not growing at rates that we would normally see. So they're hesitant in filling those positions without finding kind of the perfect candidate to do that, but then also having to compete on the compensation part of it and making their open positions attractive. So when we ask them, what does the next 6 months look like as far as business conditions, still a low number or a net negative % of them are saying that they don't see business conditions as improving in the next 6 months as those that say that it is improving. So still more of them don't see the near future as growing or as being favorable to their business, generally speaking. When we ask them about whether they think that it's a good time to expand their business, still low levels or percentage of small business owners are saying that they find it a good environment for business expansion. However, because the economy is growing, even though at a slow pace, they are finding opportunities to hire 1 or 2 employees, and so there is, now this challenge of having open positions, being still fairly risk adverse, the challenges of hiring that next person, and the competitive compensation packages that they can offer. In a broader context, we're still looking at small businesses that in 5 years, new businesses go out of business. So half of new businesses go out of business in 5 years. About a third survive 10 years. So it's a very dynamic population that we're looking at across all sorts of industry, all types of industries, most industries, more heavily into retail and residential construction, that's still lagging. But there are the churn of small businesses is always there. So thinking about how they offer benefits that are long-term benefits, knowing that they are just in a position of being in an environment that is a little less stable than, say, GE. The GEs and Microsofts don't go in and out of business at a rate that we do. So looking at the perspective of large businesses, small businesses, I think is a challenge in making policy initiatives that blanket the entire employer population. And all the unique positions of small businesses, I think, play a really big role in making sure that they aren't negatively impacted in being able to expand, hire that new person, have these jobs, some of which are entry-level jobs, and pricing them out of the opportunity to develop their business. So all of those kind of facets of employment and the general dynamic environment of small business, kind of merging the two is certainly a challenge on a state and federal level.
Thank you, Jim.
Thanks so much, Kimberly, to you and also to Pew. And I'm very pleased and proud to say that former colleague of mine, John Scott, is now at Pew, and I just have the highest regard for him, and great addition to your fine organization. And I personally regret that I had a commitment this morning that I could not change that prevented me from being here for the earlier sessions, because I'm sure that I would have learned a lot, and it would be very valuable in terms of the interaction. So I'll count on you to help make some of those cross sections. I just want to really make 4 brief points, which, if you're interested, we can then delve a little bit deeper during the conversation. The first one is, and as Kimberly mentioned during the intro, we represent primarily very large companies. We do work with other companies that provide services, benefit services to companies of all sizes. So we have a small business perspective on things as well. But our employer plan sponsor members are all large companies. One of the things that in recent years increasingly I hear about from vice presidents of compensation and benefits and human resources people and just anybody I'm speaking with at these companies is that they are less and less thinking about benefits in separate silos of health and retirement and so forth, and looking at it much more holistically as what is needed to provide personal financial security, to provide health and financial well-being, and therefore thinking of course health and retirement, but also life insurance, long-term disability, long-term care, etc. And that plays itself out both in terms of the way they're trying to look at designing their benefits package, but also has some public policy implications as well in terms of seeking more opportunities for greater flexibility along those lines. Second point I just want to make is, as you may know, the tax expenditure for employer-sponsored health coverage and employer-sponsored retirement coverage, that is the amount of money that the federal government estimates that it loses, does not collect in tax revenue as a result of the tax favored treatment of benefits, are the two largest expenditures in the entire federal budget, larger than the perceived revenue loss associated with the deduction one gets for home mortgages, or the deduction you get on your federal return for the state and local taxes you paid, or charitable contributions. For healthcare, the estimate over the next 10-year period is $2.7 trillion with a T of foregone revenue associated with employer-sponsored health coverage. The second largest is related to employer-sponsored retirement benefits, both traditional defined benefit pension plans, but also defined contribution 401k type plans. And that number is $1.5 trillion over a 10-year period. Now, there are some real issues in terms of how those calculations are done, or the assumptions by which those calculations are done, particularly as it relates to retirement, but we can talk about that if you like. So any time that there is an interest in either comprehensive tax reform or deficit reduction, or even sometimes something short of comprehensive tax reform but more targeted, there is a lot of revenue sitting, if you will, in the benefits space. That is a frequent target. The third point really is that from a large employer perspective, it might seem somewhat counterintuitive, but the employer community large employer community in particular, very concerned about increasing sort of, if you will, state encroachment into the benefits sphere. There are important elements of the Affordable Care Act that grant the states some significant authority, particularly beginning next year in 2017. There are growing initiatives at the state level in terms of states sponsoring retirement plans for private sector employees. And then there's a plethora of other types of laws, sick leave, other types of leave laws, which from a large employer perspective, where you have employees living and working in multiple states, creates a real issue and poses the potential, with health and retirement in particular, of eroding the federal preemption protection that's been prescribed under the law since 1974. And then the last point that I would just want to reference is, and this is where there might be some differences of perspective between small and large, and that is so many of the laws and regulations in the benefits space are developed because of concerns, abuses, whether real or perceived, that exist. To the extent that those problems do exist, they would tend to be focused in the smaller business segment. And that's not to, by any means, make cast aspersions on the small business community writ large. It's just that where those problems exist, and a problem, for example, lack of ability to provide sponsor healthcare coverage. I mean, I think Holly described that challenge very, very well. Or where a small employer and small proprietor might, in fact, establish their retirement plan in such a way as to provide more security for themselves and less for their 3 or 4 or 10 employees. So the laws and the regulations are often developed, but then they proceed very often to go ahead and then exempt small businesses from coverage under these very rules. And the Affordable Care Act is sort of a perfect example of that, at least with respect to employers with fewer than 50 employees. So that creates some real issues and administrative burdens, and frankly just sort of a scratching of the head on the part of large employers who feel that they're already providing very exceptional benefits, but they have to now comply with all of these new burdensome regulations that are really designed to address situations that don't apply in the large business sector. So let me pause there, and hopefully we can examine some of those a little further.
Thank you. Eric?
Yeah, so I'm with Small Business Majority, and as a side gig, I am considering a run to replace David Cameron as Prime Minister. Was watching John Oliver last night. So who's Small Business Majority? So we are a small business research and advocacy organization. Who are we talking about? We're talking about the folks that have fewer than 100 employees. And we know a majority of those folks have fewer than 10 employees, right? And I know depending on who you talk to, the IRS or the SBA, they all have their own definitions, but that's who we're looking at. The true mom and pop shops out there that don't always have a voice at the public policy table. So small business majority comes in. We do research and polling outside of our network of business owners across the country. And so piggybacking on what Holly was saying, I'd like to kind of frame who these folks are and the makeup of what they bring to the economy. So as the nation's top job creators, small firms actually represent 99.7% of employer firms. They create 2 out of 3 net new jobs. They pay about 44% of the U.S. private sector payroll. And of the 142 million private sector workers, 42% work for themselves or for a business with 100 or fewer employees. Small employers also transcend political barriers. So roughly about 38% of them identify as Republican. 28% of them identify as independents, and then about 24% as Democrats. And we also know that they're, I think, in political campaigns, the number 2 trusted messenger, right behind veterans. So they're an important part of our economy and our communities, and that's why I wanted to bring that out there. But also thinking about these folks in terms of providing benefits and why it's important for them to provide benefits to all of these workers that they employ. I always think of my personal situation growing up with a mother who owned her small firm, speech pathologist. It's a traditionally female-dominated profession. She had 10 employees. They were all female. 5 of those employees actually got pregnant the same summer. So she had to figure out, a way to keep those employees. And it was actually, less costly for her to keep them on staff, on salary, than to hire new talent, years of experience that she would have had to bring in. And having maybe a state-run program, for example, like paid family leave, would have benefited her firm, quite greatly. And so I just wanted to put in context who small employers are, how we think about them, and why it's important for them to be providing these benefits, whether it's your Stone Soup Kitchens in Ithaca, New York, that hire, a few part-time and full-time workers. They now have access to paid leave. Or it's the folks, DC pops here in DC who are struggling to provide health care that is frankly still unaffordable to their employees. Those are the folks that we're thinking about, and those are the folks that we try and give them the most objective information, so at the end of the day, they can make better business decisions.
I'll actually start with you then for my first question. There's been a lot of talk, particularly in this campaign season, about the gig economy and freelancers and independent contractors and what makes for an employee. Working in the small business community, how does that play in? How does that narrative work when you're looking at small businesses and independent contractors? Are you considering them in the same group? And how does the policy need to change to reflect the changing workforce?
Yeah, so we do think about them in the same group. I graduated from college in 2008. Some of you may remember that year, and there was a big event that happened that year. And I always think about in context. So my folks were married for about 20 years before they had kids. So my cousins were, graduating from college at the time when I was going into high school. They had access to great jobs. I'm from the Pacific Northwest, so they had access to great jobs at Boeing, right? They had access to great jobs at big firms. And where I'm going with this is that when I graduated in 2008, a lot of folks with college degrees, like myself, were going into coffee shop jobs. They were becoming freelancers. They were becoming contractors, not because that's necessarily what they wanted to do, but they were forced to do. And so an important point to all of these benefits is having or is giving freelancers and contractors the ability to opt into a lot of these programs. I think Janet on the last panel brought up an important point of job block. Keeping health insurance available to all these folks is going to be an important part of these millennials and folks who are trying to start their own businesses, offering them benefits that they might otherwise have, without a big firm. We did a poll recently with Young Invincibles, And it asked, what are the barriers to entrepreneurship within your community? And secondly to student debt was a lack of access to retirement plans, right? So freelancers, because frankly, folks are being forced to and want to start their own firms in this new economy. And thinking about how to include them is going to be an important part of public policy moving forward.
Is that something that's on the agenda for either of you? Jim?
Yeah, and I think it very much is, and I think there's been some interesting research that's been done that has really tried to focus in even in a more targeted way on the special challenges of the so-called gig economy with this new concept of independent worker. Not somebody who's really truly an independent contractor, not a traditional employee. Sort of the Uber driver is the quintessential example of it, and the role of the company, can't really call them an employer, but the company as really an intermediary to tie individuals who want to perform services with ultimate customers. And therefore, what then is the role of that intermediary in terms of not just employee benefits, focus today, but sort of the whole range of human resource related issues from from EEO responsibilities to minimum wage, all the rest of it. And so as that evolves, it becomes a bigger and bigger question. And of course, there are a lot of rules and regulations out there that, in many respects, kind of governs to what extent, somebody, really does qualify as an employee and is no longer an independent contractor, and therefore various different responsibilities on the part of the employer to include those individuals.
Just to go along with that, there is this complicated relationship, often tricky relationship between small employers, independent contractors. For NFIB, we have members that are both. There are reasons that people are independent contractors. There are reasons for small businesses hiring independent contractors. And so having the kind of the regulatory balance of still allowing people to have choices of whether they are able to use an independent contractor or be an independent contractor. Because if you restrict the independent contractor to the point where their employers are or business owners are nervous about getting fined or penalized for using them, then you don't know how that will manifest, whether they'll then hire somebody in-house, whether they won't and they'll just be more efficient, whether that will limit job opportunities. So, we hear from both sides of our membership, the independent contractors and the employers and business owners that are using them, and how regulation changes that structure, could potentially change that structure, and the negative impacts that it will have for those two populations.
You mentioned earlier that the businesses that you talk to are not seeing conditions improving in the next 6 months. And looking ahead to the presidential election, I wonder for all of you how you think the rhetoric around the election and the coming election is affecting the way businesses look ahead to how they're handling benefits. Because we're talking here about how benefits affect the stability of families. And if businesses are feeling unstable looking forward, what does that mean for the families trying to plan their lives and their own personal economies looking ahead? Jim?
One of the things that I've heard for so many years from the employer members of American Benefits Council is it's not even so much the cost of providing the benefit. They understand that they're signing up for a pretty substantial cost when they sponsor a health plan or a retirement plan. What is of great concern is uncertainty, and when you can't plan. And so, whenever there is uncertainty, whether it's caused by general economic, situations caused by Brexit, or a forthcoming, election, or continued sort of political gridlock, that makes it very, very hard to think ahead. And, it filters itself down. And we've certainly seen that, I think, in the retirement space as the continuing shift, for example, from traditional defined benefit pension plans to defined contribution plans. I wouldn't attribute that to the sort of the current political climate because it's been a trend going on for some time. But when you don't know whether or not next year there's going to be some rule that changes how you might have to then fund your plan to the tune of many tens or hundreds of millions of dollars, or what you can't really predict in terms of the short-term even economic outlook, that contributes to the movement toward a defined contribution system overall, and because by definition, a defined contribution means the employer knows what their contribution will be to that employee benefit plan, as opposed to making an open-ended promise for years into the future.
Yeah. So looking at the election, and when you think about these employers, they're different sizes, different shapes. They're not monolithic. And from our research and polling shows that employers support a lot of these policies. Actually, the small firms support a lot of the policies that traditional thought might push back on. I'm talking about policies like paid sick days, paid family leave. I was just talking to a business leader in Baltimore yesterday. He runs a large business organization, and some of you may know that there's been a paid sick days campaign going on in the state of Maryland for a number of years. And they said, frankly, they weren't really concerned about it. They weren't opposing it because, guess what? A lot of these firms already offer paid sick days. They already have paid sick days policies in place. Getting sick isn't something new. And what the state is proposing is actually less robust than what they offer, right? So he said, we're just staying out of it. And I think, as Jim brought up retirement as well, I think as we look, to the future of these benefits, MyRA, Secure Choice, is going to be a big part of helping freelancers, helping small employers, as whether it's the Washington State model of a free market kind of retirement plan or another model. 80% of small business workers that work for a firm that with fewer than 25 employees don't have access to any retirement plan. And so it's going to be important, as you note, looking at both presidential candidates and how they're thinking through helping the small business community, because let's be honest, they often give a lot of lip service to that community, but then when push comes to shove, the mom and pop shop on the corner is left out. So,
if I could just real briefly add to Eric's comment, totally agree in terms of large employers, even more prevalent in terms of offering these kinds of benefits. The difference, though, is that where a smaller employer may be operating within one state or one municipality, they know what the rule is. And it's, like you say, it's either greater or less than what they're already doing or wish to do. When you're a multi-state company and you have to now treat your employees inconsistently, that creates a problem for not just the employer, but of course for their workforce.
So do your companies prefer a federal legislation that would mandate certain level of benefits across the board?
They might. They don't like mandates sort of as a matter of philosophy, certainly. And it is hard, of course, to have a one-size-fits-all for companies of all sizes. I mean, manufacturing is a very different situation than retail, et cetera, particularly when you're talking about leave and scheduling people and things of that nature. But just as we got a federal uniform law related to pensions back in 1974, because the states were proceeding in inconsistent ways, depending on how this really unfolds in terms of continued, not just state, but also local laws related to leave, it might be that some sort of a uniform approach might be. And by the way, it could be done potentially short of a mandate. In other words, you could say that the employer is not required to provide this. If they prefer to, follow Bridgeport, New Jersey's, rule on this, Bridgewater, New Jersey, and Buffalo, New York's rule on that, that would be fine. But you could have a standard where if the employer voluntarily chose to do it, then that would preempt anything that would be different, that would be coming from the state. So it would be an option for the employer to either cope with the multitude of different rules or opt for a uniform federal standard. Wouldn't have to be a requirement.
Holly, you had something you would add. In our survey, when we ask about the percent that think that it's a good time to expand their business, we ask why they think one way or the other. So for those that think it's a bad time to expand or that it's a bad expansion climate, most of them say it's because of the economic conditions that they're in. The second most cited reason is political climate. So they're looking at the political climate as, again, with huge uncertainty and the cost ramifications of what this all means for the next 6 months, for the next year, and what that increased cost will mean for their operating their business. For paid leave and some of these other mandates that are increasingly popular on a state level, most small employers do offer some sort of leave, some don't, but most do. The problem with a lot of these mandates is it boxes in what those paid leave days can be used for. So you have to allot, say, 7 days for paid sick leave, whereas before you had 7 days for paid sick leave, vacation, all of these other reasons, ways that you can use leave. And that was a benefit that was used to compete, attract, retain good employees or employees, and to offer some sort of benefit to fill positions. So limiting the scope of some of these paid leave days or benefits, it's a balance. So, going on that, we just did a survey looking at that, and asking them, do you offer paid vacation? And many of them offer paid vacation. Can you use those paid vacation days for sick? Can you use them for short periods of time off? Can you use them for all these other reasons? And a lot of it's yes. A lot of it is you have a bucket of paid days that you can use for whatever reason. Or, some of them have specific paid sick leave or family leave. And so one of the fears for small business owners is you start limiting the scope of what they're able to offer, and it restricts their ability to be competitive in this space. Some of the other regulations that they've come up against, for instance, are now they aren't able to have tax-preferred dollars go towards helping employees purchase health insurance on their own. Now they're in violation. We just did a survey that showed that 16% of small employers are still doing this, and they could be heavily penalized and fined, but they don't know that it's against the law, that their practice is now not available to them, and they're still doing this. So things like, restricting the scope, because that isn't supposedly a good benefit. They want people to offer health insurance. And this was a way of offering a benefit without directly offering health insurance. Because when we ask small employers, why don't you offer health insurance? It's cost. If we ask why they dropped health insurance, it's cost. If we ask what their biggest problem is in offering health insurance, it's cost. So the cost component of this is what drives all of their ability to offer these large expenditure benefits. And then also on the retirement side, the fiduciary rule now is breaking up the education and the advisory components that are allowed. And so it, again, complicates the process of which small employers could think about offering, say, a 401k to their employees. And so whether it's a real or perceived regulatory red tape burden of offering, it is a roadblock for many employers to even start. Most employers below 50 employees don't have a dedicated HR benefits person in place. So all of these decisions and all of the measures that they have to do to implement these benefit programs for their employees is them. And for small employers or small business owners, the most valuable asset that they have is their time in operating the business, hiring, all of those things. So the more that they divert time to implementing different types of benefits that are increasingly more complicated to implement, it causes a problem in the offer rates. I mean, for the last 10 years, offer rates have dropped for health insurance for small employers, those under 50, by 10 percentage points. I mean, that's a huge drop in those small business owners offering health insurance. Granted, there's obviously the biggest problem is cost related, but it's also the risk averseness of offering a benefit, not knowing if you're going to be able to pay for this benefit in a year or two down the road. I mean, it's one thing to offer, but you certainly don't want to take it away. That just absolutely kills morale. So finding other ways that maybe are more flexible to offer benefits is it's huge for small business owners, but it seems like the regulatory environment is trying to continually restrict their ability to do those things.
One more question from me before we turn it over to the crowd and the web for questions. And I'll give it to you, Jim. There was some talk on the last panel about childcare as a benefit. We've done a lot of reporting on Marketplace, especially in our tech show, about the very cushy benefits in Silicon Valley in terms of parental leave for both parents and things like that, and also childcare. How likely is it that the rest of America is going to start seeing benefits like that anytime soon?
Well, I mean, of course, it's been around for a long time. It is, again, related, as Holly was saying, a lot to cost. It's a particular benefit, naturally, of interest to people, who have families of that age range where they need that service. I think, in my perspective, it comes back to this concept of trying to have greater flexibility so that the employer can offer, roughly speaking, the same amount of dollars available to the employee, and for the young family that needs help on childcare, they can allocate the dollars to that. For someone else who needs to be making up for lost time because they haven't been able to put enough aside for whatever reasons into their retirement plan, allow more dollars to go in that direction. Sort of getting away from this notion of sort of these separate silos and into this much broader concept of personal financial security and being able to allocate the dollars where the employee wants to have those dollars allocated.
Are you seeing any movement in terms of structures being put in place to actually translate that idea? And
Well, there has been for a while some of that through so-called cafeteria plans and things of that nature, but those only go so far. So really, as part of our long-term public policy strategic plan, what we call our 2020 vision, we've called for this ability to sort of have these dollars be more interchangeable, or even on an even somewhat narrower basis, to simply, for example, to be able to use on a tax-preferred basis dollars that come out of a 401k plan for health coverage, to make up for the reality that fewer and fewer employers are able to offer retiree health care coverage, and yet having adequate health coverage is such a critical part of whether or not you feel financially secure in retirement. So yeah, so there's some movement there. There's been some additional sort of interest on Capitol Hill, for example, of allowing a 401k plan to on a tax-preferred basis, be able to then purchase annuities, which would give somebody the sense of the security of a traditional pension plan, even though they no longer are participating in a traditional plan, but would have some guarantee of continued stream of income. So there's some efforts, but the political gridlock is obviously, as in so many other non-benefits areas, has been an impediment.
Any quick points from you, Eric or Holly, before we turn to questions?
Yeah, I mean, Jim hit the nail on the head. You have to. I know one of the last panelists spoke about this too. Is you have to think about these issues as woven together. And on the childcare piece, I know the thought leaders in this space are grappling over, the best route to go there, whether it's a tax credit at the federal level or what that looks like. But from a small employer perspective, there's arguably, if it were to take that form, arguably no downside for small employers. They would be able to pull on that benefit, and it is, thinking through day to day, how much does it cost for a small business owner to lose their employee to go out and have to take care of a kid or take them to a child care center? What are the costs associated with that? As Holly brought up, small employers are always thinking about the dollars and cents of all these policies, and so it's an important part of the equation that our group hopes will be part of the national conversation with paid leave and raising wages moving forward.
I also think there's a component of looking at small employers as, many small employers, their workforce or the nature of their business is seasonal, highly seasonal, or their sales are in one quarter of the calendar year, and their ability to then structure accordingly having some of these benefits in place don't make sense, and really don't make sense for the employee either, in that you're allocating dollars that would be better used in wages. So, I mean, we hear from small business owners all the time saying, you know, my workforce is really dynamic. I have a lot of young people. I have high turnover. You think of, say, restaurants and varied hours and things like that, where, you know, to be more competitive, I am looking to be more competitive on the wage front and not the benefit front, because that's what they are perceiving as the most attractive piece of offering, you know, offering a compensation package to those employees that are looking for more dollars in their paycheck. I mean, you think about, you know, the inflation or wage inflation, it's been very slow. And so people are looking for, you know, for a lot of these jobs, a larger paycheck. When you get to a certain income level, then the benefits start becoming more attractive, and maybe you divert more money into health insurance or retirement or to childcare or things like that as an employer benefit. But for many jobs, it's the take-home pay that is most important, and where the small business owners can compete in offering for open positions and for their employees.
Thank you all for those comments. And now we're turning to questions. And for those of you watching online, please do submit your questions. You can use the hashtag PewFamFinance. Who's first? Don't everyone jump up at once. All right, anyone from the web?
While we're waiting, you want me to add something?
Yeah, go ahead.
There's a recent study, I think it came out of a scholar at Harvard, who said that pointed out that we're only a few years away from a scenario where there will be actually 5 generations in the workforce. And so if ever there was a call or a need for a flexible approach, because, you know, the post-65 group's needs are clearly going to be different than the person coming right out of school, I think that statistic, you know, underscores that point.
So, question from the web. We're reading a lot about how employers are thinking about offering new kinds of benefits, like paying for their employees' student loans and other things like that. Are you seeing this, and what examples can you provide of other things people are doing that are innovative?
In our compensation survey last fall, there's a broad approach for employers offering benefits, whether it's discounts on their goods or services that they sell, tuition reimbursement, different, you know, retirement packages, health insurance. There's a broad scope of how they can create a compensation package that is attractive to potential candidates and to their employees. So they certainly are looking at all ways to create attractive employment opportunities in their business. Tuition is one of them, but also, you know, there's a huge range. But the more that there are mandated benefits, limits their ability to then divert resources and dollars to other benefits that they might think are more attractive to the folks that they're hiring.
3 quick points on that. The first is that, yes, the student loan repayment is something that we hear about. I mean, that's kind of been a hot issue lately. Kind of a somewhat related one, I guess, to sort of age is greater flexibility relative to family leave or for care for elderly parents. You know, some sort of time off for that, or some sort of a, you know, insurance that might help people, you know, who are kind of in the proverbial sandwich generation. Second point, there's been a big growing movement in recent years in the so-called voluntary benefits space, and these would be things that might be generally considered to be, you know, fringe benefits, you know, pet insurance, and, you know, you name it. Not core benefits, clearly, but benefits where they're largely employee paid, but the employee gets the benefit of group purchasing rates because it's, you know, obtained through the employer. And then the last point, and I think this is I found most of these statistics actually very encouraging, because while it's true that we hear from our tech companies and other companies that have primarily younger workforces that some of these other kinds of benefits that we're talking about are more of greater interest, it's really interesting to see some of the findings. If you bear with me, I'll just read a couple of quick statistics that show that even the youngest employees seem to be quite focused on core benefits. So there was a study that came out of the International Society of Certified Employee Benefits that found that 77% of young millennials, age 18 to 25, are likely to say that insurance coverage is very important to them, even more than the older millennials, ages 26 to 30. Only 71% of them said that it was very important to them, and yet you would think that that older cohort, if you will, are clearly the ones who are more likely to be starting families and whatnot. A TD Ameritrade survey found that 56% of workers under the age of 35 are making regular contributions to their retirement savings, whereas only 46% of the older Generation Xers and the baby boomers are doing so. Now, is this a function of the fact that those older Xers and boomers don't have as much discretionary income actually as the younger people because they're putting kids through college or whatever? Maybe, but maybe it also means that all of the drumbeat warnings about the need to start saving at a younger age are actually paying off. And if you bear with me for just one more, 81% of today's younger workers prefer guarantees that offer stable but somewhat lower returns over a higher degree of risk because the returns could be greater. That's 6% higher than for Generation Xers and 7% higher than for younger boomers. Now, I don't know whether this is a good news or a bad news statistic. To the extent that those younger folks are being essentially more conservative in their thinking around this, either they're recognizing the reality of the workforce and the economy that they've come to enter coming out of school, or they're not getting through the message that they really can afford to be more, less risk averse. They can afford to take greater risks than the boomers who are closer to retirement because they'll have more years to make it up. I suppose the future will tell us whether that was very informed and wise on their part, or whether they were really cheating themselves by thinking in a too conservative fashion in terms of their investments.
Yeah, I mean, I have pet insurance. It's amazing. Just a plug for that there.
You don't have a pet.
Right, yeah. No, so to the web question, I mean, Jim, once again, I think hit the bottom of the park with his statistics. A lot of these younger folks are really thinking about these core benefits, whether it's healthcare or paid leave. And as we think about, the ages in our shifting workforce, folks that are coming up in their careers and working for some of these small firms will, frankly, have probably an older family member that may get sick, or they may need to take time off to take care of that person, or to shuttle them back and forth between a hospital. And so, I personally think, and through our research, that folks would rather have a lot of these core benefits than thinking through higher pay. But it's an important part of the discussion as we just think long term here. So,
quick take from all three of you. What's the most innovative / unique / crazy benefit you've heard of from the people with whom you work?
Usually you don't find the word crazy.
No.
Yeah.
You notice I said innovative
people
first.
think of themselves as fairly routine.
I said innovative first.
Oh gosh, I don't know. I mean, so much of our conversation is, sometimes they think that it's, the cost of offering health insurance is crazy, and trying to manage these large benefits that a lot of folks are expecting to receive in employment, and they're trying to compete. So I haven't heard much, of A lot of it's just, discounts on the goods and services that they provide, or discounts on gym memberships, things like that are kind of the ancillary benefits that they offer. But I don't know that I've heard of any crazy ones.
I don't know whether this really doesn't necessarily qualify under the term crazy, but it's interesting because it's not necessarily, quote unquote, a benefit in everyone's mind. And that is the increasing desire and activity on the part of employers to offer wellness programs. And what's interesting about that is that for many employers, particularly those that have high turnover rates, the employers don't really see any return on that investment. In fact, it's costing them more to have it. But what they do find is, in general, they may have a healthier workforce, and so there's some benefit to them, even financially, in terms of having more productive workers. But it sends a really positive signal to the employees that, you know what, we care about you and your health, even though we're really not going to save money on our health care expenses, and and you're not going to be here long enough for it to make a difference in terms of when you get to an age where you're going to be using health care on a more intense basis. So that's only crazy from the perspective that it sort of grew up, if you will, as sort of a benefit, but it really permeates much deeper into the employer-employee relationship.
Any other questions from the crowd or from the web?
Matthew Ray from the Kaiser Family Foundation. Holly, thank you for your comments on employers who want to give cash instead of benefits to buy coverage outside of the employer. I was wondering if the Federation had a stance on whether that contribution should be tax preferred, and if so, if you believe that employees at firms who don't offer benefits but their employer gives them cash should be able to buy subsidized coverage on the exchanges.
Well, it's something that they're doing currently, offering tax-preferred dollars to their employees to offer or to purchase health insurance.
Right.
Yes, exactly. And again, having the flexibility to offer something like that, I think, is really helpful for small businesses that can't afford health insurance, that they are afforded the opportunity to contribute on a tax-preferred level with those that are offering health insurance, the plans themselves, as a recruitment and retention tool. And it gives them an opportunity to say, I value your efforts in purchasing health insurance on the exchange, which is still expensive, even with a lot of the tax credits and on the individual level. So I think it should still be, I think it should be allowed, that tax preferred basis for employers.
It's an extremely timely question because the House of Representatives last week passed a bill that essentially enables employers to put money into something like a health reimbursement account so that they can use that to purchase coverage on the exchange. The Senate is probably going to vote on it today, and it's limited actually to employers with fewer than 50 employees. Naturally, our members, because we kind of also included that in our long-term strategic plan, would love to see it expanded for larger employers if in fact it becomes law, but it looks like it might be on a pathway to becoming law.
I think if you start looking at limiting the scope to those employees who don't receive or receive some threshold of subsidy or tax credit on the exchange, then it just gets so complicated in the trying to figure out who's who and who's getting what and all of that, and we've kind of had a mess up till now dealing with just income and who qualifies for all this stuff, that I think that would be a huge challenge to try to regulate on the other end, so who qualifies for it. And so, for the amount of money that's being introduced in this benefit, I think it's far easier and frankly really helpful for the employer and the employees to allow for the tax-preferred basis, regardless of what they're getting on the other side.
Yeah, I mean, what we've seen in the small business space around healthcare is our group did a lot of educating folks, actually enrolling them as well in the small business exchanges that were set up by states or are run in some states by the federal government. And a lot of emphasis, which isn't a surprise to folks in this room, but was put on the individual marketplace, and the SHOP, Small Business Health Options Program marketplaces were really left out of that. And so as we educated these folks on the small business marketplace, and that we would walk them through the process, hours of holding their hand, we'd get to the end, and the price point was just, it was still very expensive. There was a narrow slice of business owners of small firms that would be eligible for that tax credit if you had fewer than 25 employees and so on. So at the end of the day, what we were telling a lot of these folks is, hey, take a look at the individual marketplace. Send your employees over there where they may be eligible for subsidies, because at the end of the day, the plans on the small business marketplace were still quite unaffordable for these folks.
And that kind of gets to these ongoing challenges of balancing what kind of benefits companies and employers can give versus keeping their businesses running. So thank you all for your comments. We're wrapped up for the day, and I appreciate all of your attention, and to those of you watching on the web, and thanks again to Pew for inviting us. You guys have a great day.
Thank you. Now, Governor of Washington State.
Thank you very much to our panel. We are now going to take a 20-minute break for everyone to get lunch. In the room behind you where there was breakfast this morning, there is lunch set up. Please go ahead and take your time, get some food, stretch your legs, continue live tweeting as you have been, and we will meet back here for our lunchtime panel in a few minutes. Thanks. So this is now our third and final panel focused on the future of work and the employer-employee relationship. I'm very pleased to introduce our moderator for this panel, Sarah Saddlemeyer. Sarah is an officer with our project, the Financial Security and Mobility Team, where she contributes to our original research on the connection between Americans' short-term economic security and their longer-term economic mobility. She has a lead role in exploring the intersection between employer-sponsored benefits and family economic security, and designed and organized the event today. Before coming to Pew, Sarah was a research fellow in the Office of Planning, Research, and Evaluation in the Administration for Children and Families within the U.S. Department of Health and Human Services. She previously worked for the Kaiser Family Foundation, the Urban Institute, and the California Department of Healthcare Services. She holds master's degrees in public policy and public health from the University of California, Berkeley. Sarah, I'll turn it to you.
Thanks so much, Erin, and thanks to our panel for being here today. We've heard from some really smart people all day about the landscape of employer-sponsored benefits and about how changes in that landscape are impacting both workers and employers. And this panel is really exciting to me. I'm a little bit biased, but this panel is really exciting because it brings all those themes together. It allows us to highlight the role of research, policy, advocacy, and philanthropy in this evolving field. So what are we seeing now, and what are the opportunities and the challenges for the future? So I'm going to quickly introduce our panelists, and then they're each going to spend a couple minutes providing some context before we dive into discussion. But just a reminder to those of you in the room and online, you can follow along and contribute to the discussion using the hashtag PewFamFinance. So directly to my left, Arnie Kalleberg is a professor of sociology at the University of North Carolina at Chapel Hill. He's published extensively on topics related to the sociology of work, organizations, occupations and industries, labor markets, and social stratification. Angela Rashidi, directly to his left, is a research fellow in poverty studies at the American Enterprise Institute, where she studies the effect of public policy and existing support programs on low-income families. To her left is Richard Luss, a senior research economist at Willis Towers Watson's Research and Innovation Center. He has written and spoken on rewards programs, employee engagement and behavior, and executive compensation. And then last, but certainly not least, is Aditi Vaidya, a senior program officer for the Solidago Foundation and Sea Forward Fund, and manages the economic strategies for the foundations. She has experience in a range of fields, including philanthropy, legislative advocacy, and community and worker organizing. So I will turn it over to you.
Thanks, Sarah. I'd like to start off by making 4 points about the context the nature of the changing nature of the employee-employer relationship in the United States in recent years. Beginning in the mid-1970s and continuing to the present, the nature of the employment relationship fundamentally changed. We went from what we might call a standard employment relationship, which was in place since World War II, to the kind of precarious, non-standard situation we have today. There were a number of reasons for this, which I'm not going to go into. I don't have time, but globalization, technological change, political decisions to deregulate markets, decline of unions were all responsible. The standard employment relationship was very important for several reasons. One is that it was the basis of the construction of labor law. And the second, and most relevant to this discussion, is that it formed the basis for our American model of corporate-driven benefit distribution. Beginning in the late 40s, most notably by the Treaty of Detroit in 1949, between GM and the UAW, this began the start of how of the American model of distributing benefits, health insurance, pension benefits, through corporations. This is very unique in the world, and it started back then. And the standard employment relationship was the driver of this. The second point I want to make is that there have been changes in the nature of the employment relationship because of this. Career paths have now changed. There's been a decline in employer training and a huge increase in the uncertainty that workers face. The third point is that associated with this has been a shift in risks from the employer bearing the risk to the employee bearing the risk. And this is exemplified, for example, by the substitution of defined benefit plans with defined contribution plans, and so on. And the fourth point is that because of this, and we are now in this new era, we need to identify new ways for employees to collectivize this risk. And I'll expand on these points as we discuss. Thank you.
Good afternoon, everybody. I'm Angela Rashidi, Research Fellow for the American Enterprise Institute. I just want to first thank Pew and thank Sarah for inviting me here this afternoon. Well, the whole event, actually. I learned a lot this morning. As Sarah mentioned, my work primarily focuses on issues related to poverty and low-income populations. While at AEI, I do a lot of work on federal policy. But prior to that, I was the director for research and policy at the New York City Department of Social Services, working very closely with safety net programs for low-income populations. So my expertise is generally in large federal or state-run safety net programs, but my research really focuses on the interrelation between poverty and primarily work and work supports. So in thinking about the future of work, I just wanted to make sort of a few quick points before we get to the Q&A session. One is we kind of heard about this morning, and we just heard a little bit about this from Arnie, but this sense of nostalgia for the 1950s, and on one side where the nostalgia around employees being protected either by unions or by government, and kind of this idea that once people started in a career with an employer, they stayed in that career and with that employer for a number of years, and what that means. And there is, I feel, a general sense that people would like to get back to that. But in reality, I mean, that is gone, and it's just not coming back. And I think we all sort of recognize that. It doesn't make it any less desirable, but we should all be very clear that that is gone. So from my perspective, when we think about the future of work, it really is kind of now, and has been sort of evolving over the past several years. In one way, we have a very dynamic labor market, dynamic workforce, but that also means that it's very volatile. And so there's a lot of positive and negative things that go along with that. And one of those, or some of the positive and negative things are, what does that mean for the employer-employee relationship? And hopefully we'll talk about this a little bit in the Q&A, but some want the response to kind of this changing dynamic of the labor market and the changing relationship between employers and employees. Some want government to step in and sort of force employers to behave in a certain way, in some sense to get back to maybe that time period before, and in other ways just to provide protections to employees that many feel are no longer there. On the other side, some want to just not do anything and let employees just completely fend for themselves. And again, in sort of reality, my view is that from a public policy perspective, we really need to come down somewhere in the middle. And we need to recognize the reality of the current labor market and the realities that businesses face. We heard the panel before this one was reflecting the business perspective, and that's a real perspective. And businesses are what drives our economy. And so we have to really recognize the realities that businesses face every day. But the last point I want to make is that in this new environment, and once we sort of figure out what is the appropriate role for employers, employees, and government, we also have to recognize that government does play a role. If we have a new economy and if the employer-employee relationship is going to change, we may need to just accept that, and then public policy and government's responsibility is to try to fill the gaps that are no longer filled by the employer-employee relationship. And there's a lot of issues related to that hopefully we'll get to talk a little bit about, but from my perspective, it's really the three components need to come together in terms of employer, employee, and government support.
Thank you. My name is Rich Luss, and I am a senior economist at the Willis Towers Watson Research and Innovation Center. I'd like to thank Pew for inviting us to be part of this discussion. I'd also like to caveat that what I say will mostly be my own opinion and shouldn't be attributed to Willis Towers Watson as an organization or any of the other employees there. And what I'd like to do is to kind of talk through just a few things that we found or we're finding in 3 of our large global studies. So we do 2 global employee attitude studies. One, the Global Benefits Attitude Study, which speaks to employees' attitudes around benefit-related issues and links that to employee engagement and productivity. And also our Global Workforce Study, which covers some of the same issues, but also the gamut of employee-employer relations. And then our Global Talent Management and Rewards Study, which we have just completed, with the results coming out in September. And that's an employer version, which covers, again, the reward and talent programs. So I just would like to kind of focus on just a couple of points. And first of all, the changes that we see are definitely real in terms of the gig economy or the impact of changes in how the employer-employee relationship is occurring. But they tend to occur outside of the purview of our traditional HR model. So in many ways, the changing nature of work is taking place through procurement, through the line of business, not through our HR people. And therefore, in some ways, they're not really directly involved or aware of all of the changes that are going on. And that's in contrast to our reward and benefit packages, which are definitely directly under their purview. So what we're seeing is that any effects of the change in the way work is being done in some way is going on outside of what's going on in the reward and talent programs, which doesn't mean there aren't implications. So there are all kinds of implications on the kind of the interaction between employees and talent who works with the organization but are not traditional employees, and the implications that have for managers, the implications that has for other employees who are working with them. So those things are real. In addition, technology is is having an effect on the organization through HR's world, and that occurs through both the redesign of jobs. So some jobs are requiring more and more skill. Some jobs are being redesigned to require less skills. As a result, we're moving away from some of those middle skills, which removes some of the rungs on the ladder for career advancement. It has strong implications there. And it has winners and losers, right? Some people with tech skills are seeing a strong increase in their compensation. Others, whose jobs are in some ways being shrunk, may not see the same wage growth, and that has financial security implications. In that context, it's not surprising that employee attitudes for job security are really strong. There's a real appetite for that. We've been doing these studies on employee attitudes for as long as I've been working at Willis Towers Watson, which is 18 years. And job security is still in high demand amongst employees. But it's not necessarily job security in the sense of a guaranteed job for life. So last year, I took a deep dive into kind of what are the attitudes of people who want job security. And only about 30% of them are actually worried about losing their job. There's another group who yes, they want job security in the sense of financial security. But there's really three other real segments who represent more than half of the people who say they want job security. And what they're really looking for are things like they're happy at their job the way it currently is and they don't want it to change too much. Or they prefer stability. Or they're thinking about a long-term career and they want to make changes on their schedule, 3 to 5 years in time, not having things thrust upon them. So really, when we think about job security, there are opportunities for organizations to provide something in that security family that isn't necessarily a guaranteed job, but that really gives them opportunities. And there's really an opportunity to gain a competitive advantage if you as an organization can do that. And I think that's really important because, kind of the last point I want to make is I don't think there should be a one-size-fits-all model. Because what employees are telling us is, for years you have told me that the customer is always right. We have to understand the customer and offer the customer what we offer. And it's not surprising that employees have turned back and said, when do I get to be the customer? Right? You have an employee value proposition. Does it fit my needs? Is the employee experience something that fits what I want? And so I think we should be looking at, as organizations, looking at what kind of organizations we want to be and what we're going to offer to appeal to them. So some people definitely have a strong emphasis on base salary or cash and benefits. But there's other people who join an organization because of the people. They want to work with good coworkers, a good manager who understands them, leadership who they respect and who they think cares about their well-being. And benefit programs play a role in that. There's other people who are in it for incentives and opportunities, right? They want a chance to earn more and grow in their career. And there's people who join for the nature of the work. They just love what they do. I suspect everybody on this panel would fall into that category based on the way you've described what you do. And then there are people who join for the purpose of the organization, right? Because they're really committed to what the organization is offering. And so I think if we start to think of those things in that framework and how we can look at our relationship and how to appeal to employees based on who we want to be, then I think we can really do a better job of meeting the employee needs. And that will include a sense of security, but it may not be limited to just that.
Well, thank you first for the invitation and for the opportunity to share another philanthropic perspective on these important questions. I want to pull back a little bit having around benefits and employer-employee relationships, because I think many of the questions and ideas that are being raised begs a broader question of really what kind of economy do we want more broadly. So, we've been using some of the terms on-demand economy, the gig economy, contingent work, and they actually mean different things to different people. That we also know that the on-demand economy has existed for many, many years, and that the reality is that millions of U.S. workers who used to have full-time, more stable, permanent employment are seeing and experiencing a rise in contingent work. And that part-time, temporary, we've heard this in some of the previous panels, gig to gig and kind of less stable workplaces are on the rise. So we've heard a lot of data on this. I just want to share some additional perspectives and data points that we see as important at Solidago and C-Forward Fund, and then can share more about who we are later. So additional trends I think are important to consider. So in 2016, we're experiencing a record of about 47% of the U.S. workforce being women, that there's a rise in people of color and workers without a college degree in the workforce, and that in fact there will be the majority in 2032. And so there's a real new majority in some ways of the American workforce and a change in demographic. And that really, when we talk about the on-demand economy, from where we sit and some of the funders that we work with in this sector, we know that there are historical reasons why certain populations have been excluded from labor law. So again, people of color, women, immigrant workers who are becoming the new majority have been historically excluded. So these changing demographics and the historical context are really important to consider as we talk about how to kind of upgrade the 2.0, the kind of in the kind of economy that we want. The other important voice that I think is central to this conversation that are a real core to, I think, civil society and the ways in which we engage as a foundation is a set of worker organizations, community organizations, really grassroots groups that have been working with workers on the ground, residents on the ground, some of the employees that we talk about and the statistics that we've been naming, and specifically in low-wage sectors of the economy. So at Solidago and C-Forward, we fund grassroots organizations with memberships and leadership from low-wage worker sectors and communities that are most affected by some of these questions, and really support them to, and this is a term that we haven't heard so far in this conversation, but really to build power and build a power of workers and the worker voice, and really of communities to have a say around answering some of these questions. And many of the questions that we're talking about in terms of employer-employee relationships and the ways in which public policy discussion should be shaped are the exact same questions that these organizations are grappling with and trying to kind of work with a set of both high-road employers as well as the public sector to engage in. So I think the fact that we're seeing people fundamentally ask questions more publicly about what kind of things do we want to expect from our economy, including obviously employer-employee relationships and benefits, is important, that larger context. And then even what is the role of the public sector? I think we've seen that come up as a core question in these conversations that certainly in philanthropy we see as there is an important role. There isn't a neutral role for the public sector to be playing. And that in fact, what that role is goes in some ways beyond regulation, and that really, again, the question around power and who has it and the voice of workers in that context really does matter. And the last thing I'll say as part of just these opening questions and thoughts before we go deeper is how can we support the ability for really new types of experimentation and create the spaces for not just employers, both large and small. We've heard that this business is not a monolithic sector by any means, but really create the spaces that allows for a range of voices, including worker voices, to be sitting at the table to think about some of these solutions. So I'll stop there.
Great. So I will actually direct my first question at you. So what do you see in this area are issues of interest with other philanthropies that you've been working with?
Mm-hmm. So we, philanthropy is a huge sector. So name that first. We kind of enter this in a very particular way. So we work with a range of funders who, through, for example, Neighborhood Funders Group, which hosts a program called Funders for a Just Economy, that has been around for many, many years, and foundations that have been supporting worker organizing, legislative advocacy, and again, this infrastructure of civil society that really helps to aggregate and support workers and communities to have a voice. And so that has existed for a while, and I think these questions around contingent work, fissured work, what the changing labor market looks like, and what the role of philanthropy is in supporting both answering questions that are allow for stability for workers and security for workers, but also flexibility and experimentation are all things that groups like that are looking at. But I think there are also other funders who are interested in using a range of tools that we have in philanthropy. So both 501c3 dollars that we at the Solidago Foundation use definitely to support education, leadership, and other qualities. 501c4 dollars to really support lobbying, advocacy, and those kinds of capacities to engage more squarely. The election came up in this conversation, and so, but really engage more as independent governing organizations in more of the issues and the policy questions at hand. And then also impact investing dollars, so both program-related investment, mission-related investment dollars to support a range of enterprises that are really thinking about new models, new experiments, and not just to build the business sector that are high road, that include high road employers, but frankly also to test out new ways of thinking about how to address both revenue generation questions, partnerships with the public sector, and really working with high road employers who are looking to meet some of the standards that I think we've been talking about here.
Great. I'm going to put a pin in that innovation idea because I think we'll probably come back to that. But I want to address a question for Angela. You mentioned a little bit that there was a role for government to play. What do you see as the interaction? What is the ideal for the market versus government versus other public and private sector actors?
Sure, and I mean, that's a great question because, you know, at AEI, we all generally share a philosophy that the free market is really what solves most of our societal problems and, you know, is really the best economic model. So with that sense, you know, even in the US, we're thought of as having a free market economy, but in many senses it's not, right? And so what's the proper balance for that? In an ideal world, you know, you'd have government would just be hands-off and would allow business to, you know, free market forces would allow business to thrive and they would provide jobs and, you know, everything would be great. But in reality, as we all know, sometimes people fall through the cracks in terms of the free market. What we've seen over the past, you know, several years, decade, which Arnie again sort of mentioned, is this kind of polarization of the labor market that's been driven by globalization, technology change, you know, things like that have created a lot of high-skilled jobs and a lot of low-skilled jobs. And so, and I think from a free market perspective, that's, you know, that's what's going to happen when you have a free market that's become global. So the role for government then, from my perspective, is to fill in some of the gaps that maybe the free market is not producing the sort of societal benefits that we as a society, as a country, would hope to have. And that's really focusing on the low end of the market. So those who, you know, are working in low wage jobs because maybe they have low skills, they may not have access to health insurance, for example, from their employer. They are not going to have access to retirement accounts. They're not going to have, in many cases, access to unemployment insurance even when they lose their job. They likely are not going to have access to even Family Medical Leave Act, so even unpaid leave when they have children. So there's a lot of sort of gaps for the low end of the market, and for our free economy to work in a society that we want low-income people and poor-income people to be taken care of, that, from my perspective, is the role for the government rather than role for businesses.
And did you want to jump in?
Yeah, I want to push back a little bit on this idea that in an ideal world, the free market will operate, because I think in that world has been here at one point. But what happens when the free market operates is you're going to get winners and losers. And this happened years ago when the New Deal, to some extent, was a response to the problems caused by operation of the market. The deregulation of markets in the 80s in the United States contributed to the kind of huge polarization that we have. So it seems to me that the idea of the free market being the goal is not what I would argue is the case. But I do agree that there needs to be a balance between employers and the government. I think one thing we should get clear, though, is that the entity that should not be responsible for dealing with these concerns is the individual. These are structural social problems, and individuals should not be expected to deal with the kinds of problems we've been discussing here today. I also don't think that the responsibility is employers, because the idea that employers should be responsible for providing health insurance and pension benefits and so on is an accident of American history. And now that happened 67 years ago. It's kind of too late to go back to square one at this point. But it seems to me that there needs to be an important role for the government here to play. The role of the government, it seems to me, is to collectivize risk. And it's the role of the government to take the lead in protecting individuals, especially in this new precarious age where employers, and I will argue this a little bit later if you have time, employers should not, people don't work for employers for that long anymore. And so the idea of employers providing these benefits seems to me an idea that went away a long time ago.
So I want to also bring Rich into this discussion. You mentioned that the nature of work is changing outside the purview of HR. Do you feel like there is a role for employers? Sort of where do you fall on this spectrum?
Yeah, so absolutely. In terms of the role of the employer, there's no doubt that the nature of work is changing, but I think it's wrong to assume that there aren't a lot of long tenured employees. There aren't a lot of employees who are going to remain at just a very few employers throughout their active career. So if you ignore the fact that most people will probably have jobs, a lot of jobs when they're in college or in younger ages, there still is a place for the long tenured employee, and I think that's there's also a role for the employer in that, and it's desirable for the employer for a number of reasons. So first of all, turnover is costly. We've done some calculations and things that I think a standard rule of thumb at one point was that if you lost an employee, it cost about 6 months worth of pay to replace them when you take into account lost productivity and all the other costs that go into it. It varies a lot by role, it varies by country, it varies by employer, but there certainly is, I think it's fair to say that for most organizations, the amount of the value of their workforce that's at risk for lost productivity due to turnover is probably around 20 to 25% of the total comp budget for any particular year. So the potential risk of lost productivity because of turnover is enormous. And so employers need to and do things to kind of extend that relationship, and not just for critical skill employees or employees who are high potentials, but even for employees generally. I think that's very valuable. The other thing I would say is that some of these issues, even if they're not related to turnover, we heard one of the earlier panelists talk about having benefits for people who weren't going to be around very long, to where they'd reap the rewards for that. But the fact is that if you as an employer can demonstrate that you have a concern or commitment to employees, even if there's no direct potential link to reduce benefit costs 20 years from now because they won't be there, the fact is being seen as an employer who is concerned about employees can be a competitive advantage in getting people in the marketplace. And lastly, look, financial security concerns are ubiquitous. I mean, probably 40% of the employee population at least has those concerns, and half of those people are telling us that those things are affecting their productivity at work. It'd be foolish to think that somebody who's concerned about financial issues or the foreclosure of their house or any other serious cost is going to show up at work and put that behind them and be fully productive that day. And so there's a huge potential productivity drain. So in all of those cases, I think employers have a strong role to play and are very concerned about building that relationship with employees, and that shows up in benefit programs. That shows up in a lot of other areas as well.
Great. So we've talked a lot, this is for the whole panel, we've talked a lot all day and some in this panel about risk to workers, risk to employers. Are there any benefits to the new structure of work, the future of work, for employers and for employees? And if so, what are those benefits?
I think we are as someone, an economist once described, the winner-take-all economy. I mean, there are some people who have benefited a great deal from this economy. Those who have the skills, the motivation, the opportunities to establish their own businesses, they can do quite well. And our technologically driven economy has made it possible for people to start businesses with relatively small investment. We don't need large public corporations anymore to start a business. Look at Uber and other virtual companies. So I think for those kind of folks, the new economy and the new form of work has done very well. On the other hand, there are many people who have not been able to take advantage of the flexibility and the dynamism of the new economy. Older people who are laid off from their jobs because their companies have gone overseas. Younger people who don't have enough education. Minority folks who don't have the ability to go to take the kind of education. So it's going to be winners and losers, and that's the kind of the polarization that Rich was talking about. And so I think it's very, very uneven. We've talked about variation today. Clint mentioned that in his talk. And I think that's the hallmark of this new economy. There's extreme variation.
I would agree that it's been uneven, but I would argue that there are a lot of benefits for many workers across the spectrum. So, you know, one of the benefits is just there's jobs available. And so, you know, you think back even to the 1950s when you didn't have women in the labor market, there just, you know, there weren't the jobs. So a changing economy means more and more jobs. And yes, some of them are low-wage jobs. But in terms of the new sort of gig economy that we keep talking about today, that also is, you know, there's obvious benefits to that for many low-skill workers. You know, and the gig economy is not just Uber, it's TaskRabbit or whatever they call it, where anybody can go online and, you know, get a job as a landscaper for the day or get a, you know, a moving job. And that presents a lot of opportunity for people who don't have many skills or who you know, have low education and are just trying to get into the labor market, because the truth is, you know, those are the workers, the young workers with limited skills who have the hardest time getting into or getting a job with an employer who is going to provide stability and going to provide benefits to them. So the more experience they can gain through some of these other mechanisms is going to be a benefit for them.
And I would argue, I mean, one of the things that we heard discussed earlier was childcare as a potential benefit, as a potential issue. But the way the workforce has changed, and so in some sense, not just the people who are able to, you know, work for a few days when it's convenient, you know, for particular things, and not work on particular days when it's not convenient or they have other needs, but the ability to arrange your schedule, the ability to work remotely, a lot of those factors. And those are, a lot of employees are taking advantage of that, even if they're not on that as a formal program. But the ability to do that has greatly enhanced people's abilities to manage work-related stress, which is another key drain on productivity at the organizations and a key drain on the person's individual life as well. And so there's been a huge benefit as a result, which has made it easier for people who had not been in the workforce previously to participate in the workforce, such as women entering the marketplace and things. A lot of things have allowed for flexibility, so you don't necessarily need to limit yourself to a job that, you know, you can put a child on the bus and then be there to get them, you know, that's only 6 hours a day. You can work a full-time job and work according to a flexible schedule, and maybe work remotely when you need to take care of your children, and work when it's convenient and not, even within the context of a, you know, traditional employment, 40-hour a week or more, and still, you know, have all of the benefits of employment without having to give up that flexibility that you need to support your life outside of the workplace, which is, I think, a huge contribution that's been made because we've been able to reallocate tasks and rearrange jobs to provide more flexibility for workers.
There have been a lot of conversations in philanthropy about the future of work, and I even just came from one yesterday in New York. And I think the gig economy is there isn't enough. We need more data. We need more information on exactly what we're talking about when it comes to the workforce, the demographics, really how much of the gig economy really makes up the overall economy. And from what we're finding in the early stages of this, it's actually pretty small. And so I think there's a just like there isn't a one fit answer for it all, I do think that we should put in context where the gig economy fits into some of these other conversations that we're having about employer-employee relationships in the future of work. So what I would say is There are still the relationship between employers and companies. Companies hire employers. There still is a direct relationship in many sectors. And in that context, there are labor laws and other kinds of regulations that are on the books that we need to continue to support, to enforce, right? So I think that is one that I just want to name, and some of these are larger companies. So the future of work is not, we're not suggesting that we advocate for contingent work as the future of work, right? I think we tend to focus on the gig economy and contingent work as though that is the only thing that exists, and that is not the case. And yet, because the on-demand economy, not so much the tech-based gig economy, but the on-demand contingent nature and subcontracting and temp work, that kind of thing in the economy has been around for so long. I think this conversation about future of work is really about how do those sectors, which are quite a few, transportation, construction, we talked about care, restaurants, that really, it requires, our grantees are thinking about the future of work and using opportunities for the many future of work conversations to think about, for example, with portable benefits, how can we take this as an opportunity to talk about a broader social safety net and updating social protection systems that we, building off of what we have, but not kind of throwing out what exists right now and trying to create something new. So I think this idea of a new economy is both interesting, but I don't think it's brand spanking new, right? I think it's been around for a while. And then the last thing I'll say is I do think there is an opportunity when you think about things like climate change, and there actually is a real wave of interest in rethinking our energy economy, and specifically the growth of a need for infrastructure to support our cities and states to be climate resilient. And that's actually an opportunity in the future of work category, because it really creates this question of what kind of jobs will those be, not just construction sector jobs, but other jobs as well. And I think that presents itself with a range of opportunities to really think about, from where we sit in philanthropy, the investment potential to actually help spur the kind of relationships between high road employers in this new climate resilient economy, so to speak, and again, a set of infrastructure that we've been investing in, both worker and community organizations, to help have a voice, but also in some ways think about administering programs and providing a role in partnership with government. So I think, and the last thing I'll say about this is, in philanthropy, I'm seeing there's a lot of conversation happening around enforcement. And so because of the passage of minimum wage, paid sick day laws in different parts of the country, I think in the context of future of work, part of the question is, how do we enforce these laws? And what does that look like in such a way that is in both in partnership with the workers and residents on the ground, and also actually raises some of these questions about what does government really need to be able to support enforcement of a set of laws that are actually very important to setting standards, but also maintaining those standards.
If I may just follow up briefly on Adita's good point, about the nature of the gig economy. We've talked a lot today about the gig economy, contingent work, the platform economy, the on-demand economy. The truth is we really have no data on the distribution of this in the U.S. The last survey, that was a national survey of the non-standard workforce, was done in 2005 by the Bureau of Labor Statistics. Now it's going to be done in 2017 again, but the truth is we really don't know what the composition of this is. The estimates of the so-called gig economy ranges from less than about 500,000 to everybody. So there's a big gap there. The truth is, according to very few people in the U.S. are temporary workers. It's been growing fast, but it's still a small proportion of the labor force. The only non-standard work that's really large is part-time work, but part-time work is very heterogeneous. I mean, some people want part-time work, so it's the involuntary part-time that's increased. The number of technologically, we don't know, so we need to get more data on this. And the truth is, I think most people are really working for an employer. Now, they may not be working for an employer for a long time, but they do have an employment relationship that looks like the past, except it's now precarious.
Just to add, I think you're exactly right. And what we do know, though, is that the economy has shifted in terms of the types of jobs that are available and the types of jobs worked by different demographics. So, and we also know in terms of non-standard work schedules. So, for example, I did a study looking at unmarried mothers, and it was a study looking at childcare, but I also was looking at the type of jobs that unmarried mothers were working and how many and what percentage were working non-standard hours. And so this was using Fragile Families and Child Wellbeing Study data, which was actually a survey done in the late 90s, so not completely timely. But what I found is in the early 2000s, these women, it was about 62%, I believe, of the unmarried mothers who were working a schedule that was outside of a typical 9 to 6, 5-day, a weekday hour job. And so that is a very large percentage, obviously. This is an urban population, so maybe different from rural areas, but very large population. And what my study found was that that creates challenges for them, obviously. And in terms of childcare, women, the unmarried mothers who were working these non-standard schedules, were less likely to receive government child care assistance in terms of a subsidy. And that was because they were less likely to use daycare, which makes sense because daycares typically operate on a 9 to 5 schedule. And so part of my concern, as we look at these issues, is that government is not going to be, or is not going to continue to be able to keep pace with the changes that are going on in the economy. I mean, we all know that government is not very well at staying on the cutting edge of things, and I think we're already very far behind in terms of public policy and addressing gig economy, addressing non-standard work schedules, and I think that is where, from a public policy perspective, we need to really place a lot of focus is what can public policy do, and is it even capable of sort of keeping up with all the changes that are going on?
I just want to echo on that I do think that there's a strong relation between what's going on in the redesign of jobs and things in these non-standard work arrangements and sort of the ability to customize employee experiences for employees generally. And I think, so most employees won't go to the extreme of being talent on hire for a particular task at this company today and this task and a similar task for a different company next week. Most employees won't do that, not in the near future anyway. But I do think that what has happened is that in many ways employers are rethinking what they're doing, and again I go back to employees want a consumer grade experience because they're expected to provide a consumer grade experience to their customers, and that's what they get everywhere else in life. Right? So if I go onto Amazon, they know a lot about me. They know my search history. What have I bought there before, right? I mean, I will see things that you won't. You probably don't get the same ads for goat milk that I do. Because my wife likes powdered goat milk. I get a customized experience, right? I go to my employer and, if they hand me a brochure that's the exact same brochure about, because of my age and, marital status, they give me something that's about child care benefits, and it doesn't recognize that we don't have any children, that's not going to be a good experience for me, and it's going to turn me off from the organization. And I do think that employers are trying to learn, customize the experience, because that's the way they deal with these non-standard employees. And as a result, your traditional employee is benefiting to some extent from a better experience in dealing with the organization as a whole. And so I think that, those same skills are transferable as we start dealing with our, traditional employees, if I can use that expression.
Great, so I'm going to ask one more question, and then I'm going to turn it over to the audience and the internet. I want to come back to the idea of innovation. Have you guys seen a couple or many innovative practices going on, and could you tell us a little bit about them?
Well, one example that comes to mind is the freelancers union, which is an interesting term for a union because they're made up of independent contractors. But it's founded in New York by Sarah Harowitz. It's a very big organization now. It's got well over, it was hundreds of thousands of people. And basically, they are taking independent contractors who have no employer and they're putting them together into a marketplace, so they're getting good deals on health insurance and other kinds of benefits. So this kind of collectivization of risk strikes me as a very innovative kind of distribution of fringe benefits, so to speak, in the new economy.
One innovative thing that I've seen is I like this idea of microloans, which has mostly been used in sort of the developing world, but I believe it was in Boston maybe. There was a group that was using it, focusing on low-income women. And I think that that's a tool that could be really interesting and useful and kind of, in promoting entrepreneurship. And so I'd like to see sort of some of those things that we know have been working in other parts of the world, and can we apply some of those things to our low-income communities?
I would say the kind of the most interesting and innovative things that I see in the space that I work in is around this concept of microsegmentation, in terms of bringing the marketing skills in terms of how we market things to customers to how we present our employee experience with employees, and thinking about employees beyond kind of, look, I understand that age is a very easy number to get, and it's easy to sort people into generations, but frankly, I don't think it's all that informative at the organizational level. I think at an organization, you tend to attract people who like the things that you offer as an organization, which means that your 25-year-olds are probably more similar to your 45-year-olds than they are to other 25-year-olds. So I think broad sweeping generalizations based on age or based on gender or based on a lot of other factors that are easy to observe probably aren't all that useful. But things that you can do to learn about employees based on either the geography of where they live, so the type of neighborhood they live in, can tell you some things about their lifestyle, other things that you observe through your performance management process that gives you an idea of the type of employee you're dealing with. You can apply those things to start crafting specific messages to employees, and you take advantage of portal technology to really give people, communicated messages that really are targeted not just to the things that are of interest to them, but are presented in a way that is most likely to appeal to them. And that can be really important in areas like financial well-being, where people have different challenges, and they bring different levels of experience and understanding to the table, and you have to present things in a way. So for some people, somebody who has a master's in finance and has an MBA probably doesn't need to have the benefits of diversification explained to them, whereas like we were talking about earlier, a younger person who maybe doesn't have a college degree and has never had any savings plan maybe needs to understand that they can put aside $1 and really they're only setting aside 75 cents because it's pre-tax and their employer is giving them $1. Now your 75 cents is worth $2, and how quickly that can take off. And so we can take advantage of those things to communicate and get better power with the investments that we're making. And so I think that's probably the most innovative stuff I see.
Well, I think we're seeing several innovations, and I think the innovation is such a great word because it can look like different things in different places. So I think on one example is our grantees. I think there's a lot of work happening at the local and state level. And so one of our grantees, Community Labor United, in partnership with a series of other organizations in Massachusetts, there's pending legislation that they've helped to advocate for in its introduction that would, among other things, empower the Attorney General's office to actually hold accountable not just the smaller companies that are subcontractors, but really look up the chain to really look at who is the ultimate employer of these of the products that essentially they're manufacturing, and really across the supply chain give the Attorney General some enforcement power to be able to enforce against wage theft and labor law and other things. So that's innovation in the public policy arena at a very local and state level that could have implications in other places. I think from a sectoral perspective, we have grantees like the National Domestic Workers Alliance that has created, in partnership with a set of businesses who have signed on to 8 core principles, something called the Good Work Code. And I think those are innovations in organizations really seeing the need to partner with a set of businesses that are looking to think about some of the big questions that we've been asking here: stability versus flexibility, the role of the public sector, transparency, other kinds of things. And so I think that is definitely innovative to see partnerships through things like standards of the Good Work Code, and other areas in that vein of kind of high road businesses and partnership with high road businesses. And then I think in philanthropy there is innovation in the sense that there's more conversation across what tend to be somewhat of silos, right? Where you have workforce development funders and worker rights funders and economic development, as well as, frankly, climate, funders, environmental funders, looking at some very similar questions around this question of what kind of economy do we want and the structures and systems that are needed. So I think that's promising to see that there's more conversation happening in philanthropy. And I think the theme there that I would posit is that we as a sector need to think about strategic risk and supporting strategic risk-taking among the field, and frankly really looking at experimentation a little bit differently, which is, experimentation is a theme that comes out of Silicon Valley quite frequently, right, in terms of the gig economy, and that's all really exciting. And I think the experimentation that I'm talking about is both the building off of what we know we already have, and also looking at the ways that new partnerships can think about these questions more broadly. And I'm not just talking about the 501c3 sector either. So just to name that, we're actually really broadening that to look at political questions, to look at lobbying efforts, to really think about the systems not just being economic in the business and worker categories, but frankly how our kind of democracy works to shape some of this as well.
Great. Do we have any audience or internet questions? There's one right up here.
Hi, Debbie Chalfie with AARP. Arnie, you mentioned a principle that I think many would agree with, which is that we need to figure out a way to collectivize risk, because the unit that is least able to carry the burden of all these risks is the individual. And I was wondering, one of the challenges is that, we've talked about employers having limited resources and not being able to necessarily provide more, and there's all these folks who are even unconnected to employers. That would seem to leave government, as you said, the role of collectivizing the risk. Do you have any particular ideas for ways to do that? And as someone who lives here in Washington, one of the great concerns is that there's been a lot of, political gridlock and not much happening in the way of policy advances, really in any area. So how would you address the concern that government seems, even if government might be the right place to collectivize the risk, what do you see as the possibilities for actually making that happen?
That's a great question. And given this political environment, especially in Washington, it is extremely difficult to think of anything being done. And so therefore, it's a very difficult scenario to envisage. And we're not even discussing whether or not what the proper role of government is. Some of the debate is about whether or not government should have any role at all. So I think we have got to get beyond that. The scenario that I sort of look to, there's a couple of things. One is I look to the idea, now Denmark has been used as an example. I know Denmark is 5.5 million people. They're a bunch of homogeneous Danes and so on. But they have this concept of flex security, which I think as a narrative, as a way of thinking about policy, makes a lot of sense to me. I mean, employers need flexibility to compete in the world economy. Workers need security and stability in order to deal with the kinds of consequences of that. So that's a narrative that would give some sort of model. How we get there, it seems to me that we have to start at the local level. And because things are it's going to be very difficult to get things done at the national level, given the kinds of gridlock that we have and the political polarization that we have. But the local level, I think, is very, very possible because given the potential of technology to bring people together and to eliminate spatial barriers, we can collectivize risk at local and regional levels. And it seems to me those are the levels that are incentivized to do that because they want to attract jobs and businesses to their areas. So just as the New Deal was based on experiments that occurred at state levels, so too, I think, by looking at local experiments, local, city, regional, state maybe, that would provide the models for the kind of future that hopefully one day we will be able to implement at the national level.
Does anyone else want to jump in?
Well, I'm not exactly sure I understand what you mean by collectivized risk, just because, I think of the safety net that we have already, and, you can argue whether it's adequately resourced or not, but we have federal programs already that pretty much cover, employment loss, we have food assistance, we have disability assistance. So we have a lot of programs that kind of cover people already who are at risk. Again, you can argue whether it's adequately resourced, but I guess I feel like that is sort of a collective risk concept. So I don't know. Is that something else you had in mind besides that?
Well, again, I think your key point is whether or not that's adequate to a changing economy, especially, for example, labor laws, employment protections. These were predicated on a model that was the standard employment relationship, that people worked full-time, full year, generally, and so on, and that doesn't exist anymore. So we need to update these things, and so we need new forms, I think. We have to update these kind of collectivization of risk mechanisms.
The thing I would add to that is that because of historic, essentially exclusion of certain populations of people of color, women, immigrant workers, I think there's still a lot of work to be done. That is both in you could argue it's both in the upgrading the category, but also really working to fix and think about how to include those currently excluded workers. And many of them are in contingent sectors of the economy. So it definitely raises the questions that you already raised, Arnie, around labor law, for example. And I think it begs the question of, okay, without looking at just the series of existing social safety net, there are things that are missing. We really do need to think about an upgrade for a social safety net program as well in that system.
Well, just in terms of the financial security issue, I think our data suggests that employees are basically relying on, the combination of what they're getting in Social Security or other government-provided benefits, the employer-provided benefit in their own personal savings, and each of those components is a critical role to really having financial security in the long term. And what we also are finding is that employees are quite open to the employer taking on an expanded role in financial well-being. So if you look at healthcare as a model, right, we've gone from the point where employers are, basically paid for you to have health insurance and then you are responsible for whatever, to more of a partnership where they're sharing some of the expenses, but the employer is also getting involved in the well-being space, right? More programs, more things. I think, maybe probably overly familiar with things around disease management and other emails that they send you around incentives to provide us this information, you get this incentive, right? Whether it's whatever type of program you have, and employees are open to that on the healthcare side. On the retirement side or on the financial, well-being side more generally, employees aren't necessarily there yet in terms of getting a lot of personalized messages on the details around financial security, et cetera. But there certainly is, an opportunity for employers to start making that case and getting involved in that. And I would say that the data that show that the productivity drain from employees being concerned about their finances makes a compelling business case for why employers should take some steps where they have brand permission from employees to help them with that area, because employees are expecting it and open to it to some extent. You can't overstep your bounds, and you need to be aware of which employees are going to find it intrusive and maybe a violation of their personal privacy, and which employees are looking for and really strongly desire that kind of guidance. And so I think there's a place, but employers have an opportunity, but they should be wary of that as well.
Any other questions?
Hi, Sarah. We have another question from our webcast. What is or should be the role of media in reporting on the changing employer-employee relationship? What are they not focusing on, and what should they be focusing on instead?
I think the media has, because they're in the business of reporting news, it seems to me that they report on certain trends and fads that don't capture the totality of the situation. I think a good example of that is the gig economy. I mean, that's gotten huge play in the media. And if you listen to the media, if you came from Mars and just sat there and listened to the media, you would think that everybody here is an Uber driver or a gig economy worker and so on. So, it seems to me that the media could take a step back. And now part of that is the lack of information on this. But, it seems to me that instead of chasing the flavor of the month, so to speak, you could really do a more reasoned discussion of what is going on in the future of work.
I would definitely agree with that. I think the other thing that it made me think about is the role of philanthropy in actually helping to bring some of these conversations together. So I recently read that Uber, for example, is looking at another big influx of venture capital investment. And it's fascinating to kind of look at questions of who is a company, right? So who are we really talking about? Are we talking about financiers? Are we talking about investors? And in the case of other companies, some of the other ones we're talking about in this conversation, small businesses, a range of larger corporations, what are the financial mechanisms that support high standards to be met in these sectors, both public and private? What are the models for that? And I think there's a lot of innovation happening that could be reported on, that actually stories that could be told about ways in which people are experimenting around these questions, that opens up the conversation about what do we mean by the future of work outside of Uber and Airbnb. And even within Uber and Airbnb, I think the question of we've seen a little bit around, especially Airbnb, I think Google buses and in the Silicon Valley, especially the heart of some of these questions, I think there's been a conversation about the impact to the housing market, to gentrification, kind of well-being and other questions of the gig economy to the larger economic system. And I think that opens up the door to actually talk a little bit from a media perspective about the impact to communities, right, of not just the gig economy, but the future of work more broadly.
I would echo the notion that we do tend to grasp onto the amusing anecdote or the this particular niche thing that's really new or appears to be new. The other thing that I notice is the demographic things, because, and again, this is my own opinion, but I go back to I think that in most cases the generations are not all that different in what they fundamentally want. That doesn't mean that it's not expressed differently. That doesn't mean that you necessarily can communicate through the same channels to everybody, but fundamentally people want, show me the employee who doesn't want to be paid fairly. Show me the employee who doesn't want to have some opportunity to learn or grow at their job, in some way. Show me the employee who wants a supervisor or manager who never communicates with them and has no respect for them. I mean, those things just aren't there. But people grasp onto or segments of the younger generation and say, this is what all people in their 20s are like. And frankly, it's misleading. And, I think we tend to miss the, 25 or 30% of people in their 20s who want, traditional employment relationship with good benefits, that want some kind of security, that would like to advance in their career over time, and are willing to work through that because they don't fit the stereotypical model. And so I would, I think the other thing I think that we miss is kind of that, I would say that mid-career folks who have, because there's nothing interesting or sexy about the topic of, an employee who's been in an organization for 10 to 15 years and is kind of thinking about what does that employment relationship mean? How did I get here? What skills did I acquire that could be useful for new employees in helping them learn how to deal with the challenges at work or when stressful things occur? Those kind of things aren't really mediable, but they're really important. Mm-hmm. And so those are things I would like to see more of personally, but that reflects my bias, I suppose, and maybe my age group.
Not media specific, but I think we do need more transparency just about the wages that are offered and the benefits that are offered. If you think about just from economic theory, people should know what other people are making so that, competition generates people moving to different jobs. But in reality, in my personal experience as well, is just what I've heard. People don't tell other people how much they earn, and employers don't want to tell people how much they pay them or what benefits they offer. Just seems kind of counterintuitive, so I wish there was just more transparency so that everybody would know what benefits are being offered and what the wages are.
I do think that the new CEO pay ratio rule, which will take effect in another year, will have some impact on that transparency, because you are going to know what the typical employee at every publicly traded company in your market pays. Now, that's not perfect information. There's a lot of flaws with that, but there will be some transparency, and I think that is providing an impetus to some organizations to pursue more pay transparency. And I think in general that can be a good thing if it's handled well. If it's handled poorly, it can be a disastrous thing. Speaking of amusing anecdotes, I was working at a university once, and I noticed that in my mailbox was a sheet with every single employee's pay. That was embarrassing. And it was in everybody's mailbox. And so, that can create problems too. So I think we have, there's going to be a push towards more transparency, but I think, we have to respect boundaries in that place too.
I'm getting the signal that it's time to wrap up, so if you guys will join me in thanking our panel. I think Erin is coming up to close us out for the day.
Well, thank you all. This has been such an interesting and robust discussion, and I just want to again thank sincerely all of our moderators and panelists for being with us today. As I said at the start, when we began planning this event, what we really wanted to do was create an opportunity for us to explore this intersection of employers and employees from lots of different perspectives, and to really shine lots of different lenses on the ways in which the employer-employee relationship affects financial security. And I think there have been a number of key takeaways from the panels today that I have. I hope you do too. And I want to just take a minute to reflect on a couple of key themes that I heard across the three panels that I think are worth us continuing to think about. So I think the first key takeaway here is that employer benefits absolutely matter for family financial security. Multiple speakers today talked about workers' desire to have access to benefits, and there is a broad recognition that benefits, and especially flexible application of those benefits, can play a really strong role in helping families weather financial shocks and maintain financial stability. The other thing is that benefits can be a win-win, right? There is this opportunity for benefits to be good for employees and also cost-effective for employers. But also really key point, especially made in the first panel, about this idea that there is a little bit of a tension, and we have to be aware that benefits are not the be-all end-all, just as income is not the be-all end-all. We need stability in both in order for employees to have that financial security. So portability by itself may not be a silver bullet solution if workers don't have consistent income. Consistent income alone is not effective if workers have no access to benefits. All of the panels spoke about the fact that the nature of the employer-employee relationship has shifted and that it is not going to go back to what it was before. And that is something that we all need to grapple with, especially as we think about the ways in which we move forward. There was a lot of discussion today about what does the future hold and what is the right balance as we move forward. The appropriate role for employers, employees, and the government. And we know that these three actors make up kind of like a three-legged stool to support the American economy. But there is a lot of debate still about what role each should play and the risk that should be borne by each. The relationship between state and federal policy was also raised, especially in the context of larger employers who may have workers in multiple states, especially when those states are implementing changes on their own independently, and that in that context, the government, the federal government stepping in and creating a broad standard could actually be very welcome. That, of course, is somewhat in tension to this idea that there is not going to be a one-size-fits-all approach, not only for employers who may have different workforces, be different sizes, but also for employees who may have different needs and be interested in a more customer service approach to their own benefit receipt. So all of that gives us a lot to think about. I think we will probably on our team be watching and rewatching the webcast to keep trying to pull this apart and think a little bit more about how we might move forward in terms of the research that we could do on this topic and the potential for policy intervention as well. With that, I'm going to stop and thank you all for being here today and participating so fully in the discussion. Please feel free to keep talking and sending questions our way using the hashtag PewFamFinance. We are trending on Twitter, just so everybody knows. We really look forward to seeing you at future events, and enjoy the rest of your afternoon.